this together. So guys, hello. And first, let's excuse my hair because I was in the rain this morning and my curls ain't popping like they usually do. But anyway, we're going to talk about soft nursing. So of course, I always have my laptop and I want to be able to see the comments if you have comments. So let me go on my laptop on my channel so that I can see if you have any questions, comments, concerns, hays, what up, those, all of that stuff. So let's see. Clicking on here now. I need to mute it first. There we go. So we are going to talk about the soft nursing era, because a lot of people are, I've seen it on social media. Oh, I'm a soft nurse. I'm living a soft nurse life. I'm a soft nurse. And I'm like, let me look into that. Let me see if I'm a soft nurse. So actually, what a soft, okay, let me get the definition because I did look it up. I don't want to just give y'all my opinion. The definition that I found, of course, online, talking about soft nursing. So wait, before I even get into it, it's a few people on here. Anybody that want to comment, do you know what soft nursing is? Comment in the chat. If you know what soft nursing is, let me know before I even go through that rundown of what it is. Let me know, y'all. Comment below. My child leaving for work. Anyway. Have a good day. Mm-hmm. All right, anybody, while you're here, before I get into what soft nursing is, do you know what soft nursing is? Okay, Melanie Carter. Why am I not seeing it on my computer? I can see you on my phone. 1 second, Mel. There we go. All right, so anything other than bedside nursing. That is pretty much what I thought the definition of it was, but I'll go more in depth. So, first of all, Melanie, are you a nurse? Or do you work in healthcare? Let me know. And then I'll go over the definition. Okay, the Google definition of soft nursing. So, what I wrote down was soft nursing is a position that is considered less physical, demanding, or less stressful compared to the high acuity and high stress level jobs, right? So with soft nursing, yes, master's nurse. Okay, cool. I wrote down a list of soft nursing jobs, but before I get into that, there are a lot of people that come on my channel, and I think it was a few that was on my last live that was concerned because they're older and they weren't sure if it was too old for them to go to nursing school. Psych nurse can be soft life. For some, it's not bedside, but it could turn into it. Actually, it is bedside. Let's just be honest. Because the ER, you turn into a psych nurse as well, psych holding. But that could be a soft nurse job. To me, I'm a little over psych nursing, so it wouldn't be a soft nurse job for me. But anyway, so I did talk previously on the last live, if y'all was there, so y'all heard it. If not, you're gonna hear it right now. There was a few people that were concerned of if they were too old to go to nursing school. So, and while I have you guys on here, give me a few thumbs up in the video. Hit the like button. I appreciate that. That is free. If you're not subscribed to the channel, please do so. I don't bite. Anyway, so what people can do when they go to nursing school, you work on the bedside or at the bedside for maybe a year or two, or you get into nursing and you automatically go into the soft nurse life, because back then it used to be, it was, you had to work med surge or ER or, whatever to get your foundation. And I would just think for a nurse that is fresh out of school, that's a little bit older, maybe in your 50s or 60s, and maybe you're not trying to do all that bending, twisting, and pulling, get into the soft nurse era. Because people are hiring, because it's a nurse shortage all over. It's not that there's not enough nurses, but it's not a lot of nurses that actually want to come in and work via bedside, or some don't even know about this soft nurse era where you're not doing all of this strenuous stuff to your body. So definitely I do recommend for those nurses that in school in their 50s, I think it was one young lady that said she wanted to go in her 60s, and maybe it was for like a different maybe for this is a career to retire, because I've heard that when I was in school with a couple of 50-year-old ladies, and they said this was their job to retire. So what I will say, go to school. If you want to get your associate's degree, you do 2 years, do that. If you want to go and get your bachelor's after the fact, you can do that as well. But I always recommend getting your associates, because that's only 2 years. And then you can always go back while you're working to get your bachelor's, and you can do that online. So when you're working in this soft nurse era, some jobs that I'm going to say on this list are not going to be for brand new nurses. They want you to have your nurse judgment, but some jobs are. So I'll give you an example. If you're 50 to 60 years old and you are going to, if you're going back to school for nursing, you get your associate's degree, or say you want to get your bachelor's. When you go back, let me see, I am 53. I'm about to go back to be a nurse. I want to do L&D. Awesome. So when you go back to school and you want to not really do the bedside, you don't really want to do, so Terry is going, she wants to do L&D nursing. I actually went to school and I wanted to be a labor and delivery nurse too. But stuff changes when you're in school. I still love babies, but if I had a patient that had a stillbirth, I probably would cry with them. And being the fact that I'm a mom of 3 daughters, I probably would try to take all of the little boys home. But anyway, so infusion nurse is a good one. So if you're in your, or say you've been a nurse, say you're in your 20s, and you spent all of your 20s as a nurse, and you tired of the bedside, and you want to do something that's in the soft life era, infusion nursing. So you don't have to be chemo certified to be an infusion nurse. You can apply for it. They'll train you on how to do the IV drips. It's so many, what is it? What do they call those jobs? Where they're infusion, but they're like clinics. And of course, with that, they're like a private clinic. They're more where they need the nurses to know how to put the IVs in. It's not going to be a tech to put the IV in. You're going to have to do it. So they want you to put the IV in the patient. You're going to put the medications for the infusion. And then some of them, they allow you to go to the patient's home to do infusion, like a vitamin infusion. I forgot what those clinics are, but they're pretty much medical spa. They make it sound so wonderful, medical spas. Now, the majority of those want you to have some type of nursing. You can't be a brand new nurse and just jump into a medical spa. Terry, you said, what is that? I'm not sure, because I said a couple of things. If I didn't say what it was, let me know in the comments what is that, what that is. So thank you guys for the likes. I appreciate that. So infusion nursing, yeah, and even with infusion nursing, you can do infusion nurses in the hospital, and you can actually put the IV in. I clarified it. Okay, perfect. So you can put the IV in. Of course, you need training on that. Even if you're a phlebotomist, because I was a phlebotomist, but it's different from putting in an IV. It's different things that you have to use, but you're getting in the vein. It's the same concept, but you need to have a little more training. So with infusion, you can actually work in a clinic inside of a hospital, And a lot of the infusion clinics now do chemo for the cancer patients. So as you work, you get your time in, you get your hours in, you can become chemo certified, as well as you can get your oncology nurse certification. But you have to have, I believe, 2 years in oncology and so many hours that you've worked in oncology in order to even take the test to be certified. But with chemo certification, that's different. So infusion nursing is something that I believe a brand new nurse can do, but you just have to be really efficient with IVs. So say you're a medic and you're used to putting IVs in, and you go to nursing school. That would be perfect for you because of your background. You're a medic. A lot of techs, not all, but a lot of techs, nursing assistants, patient care technicians, they put in IVs. At one of the ERs that I worked when I was a brand new nurse, the techs would put in the IVs. At the other, because I worked 2 ERs at one time. Yes, I'm a hustler. Yes. But one was per diem and one was full time. But I still worked both because one was a trauma 3 and one was, I believe it's a trauma 1. So I had both. One was a lot easier because patients would come in for the lower acuity things, and then the other one we get gunshot wounds, the stab wounds, the PEs, the heart attacks. Well, everybody can come in for a heart attack, but you know, it will be a different range of patients for both. So at the higher acuity ER that I worked at, they did not allow their PCTs, their patient care techs, to put in IVs. Now, there was something new where if the patient care tech was in nursing school and I don't know if they were in nursing school for a year, they would allow you to do it. It was something new they were trying to do when I went back to the ER per diem last year. So that portion of it, yes, they did allow. So if you have that background already and then you go to nursing school, become a nurse, and want to work in infusion, you straight. You don't have to worry about picking, pulling, and twisting anybody. You put the IVs in, you do the medications. If it's something like maybe lidocaine where you have to put somebody on a monitor to see what's going on with them to make sure everything is going smoothly, you can do that no problem. That is considered a soft nurse error position. Now it's 122 people. I can get a few more likes, please. I got 7. I appreciate those 7. But likes are free. And if you have not subscribed to She Nurse Savvy, please do so. And while I'm talking, you can always put a question in the comments. I'll stop what I'm doing and I'll answer your question if I know the answer to it. Okay, so let's get more into this soft nursing jobs per se. Now, with any job, there is going to be stress. Even if you have the easiest job, even if you have a telehealth or a remote job where you're on the phone or you're doing videos, you're going to come across some people that may be difficult. And it's okay, because remember, don't take it to heart. These patients may be frustrated about the unknown. It's something that you can't even do to help them. They may just want to lash out and throw it on you just because you're on the phone with them. Let it roll off your sleeves, because what's not going to stop? Your paycheck. So always remember that. So let's go into it. So, and if I say a position, if I mention a position that you disagree is soft nursing because you work in it and it's not that easy and it's very stressful, let me know in the comments. If I miss one, let me know in the comments, because I just wrote down about 11 of them. And a couple of them I've already done or I want to inspire to do. So let me know if these are the case, and also let me know which one is your favorite. Okay, so let's go into it. Number 1, I'm going to say for soft nursing era is occupational health nurse. So if you know what an occupational nurse is, you already know it's easy. Not easy as in you could do it with your eyes closed, but easy enough where you're not doing anything at the bedside. nothing at the bedside because patients are walking in. So if you don't know what an occupational nurse is, it's the nurses when you get hired at a hospital. Thanks, Mike. My husband love them too. When you get hired at a hospital and you come in and you get your physical, maybe you get a what are they doing there? Maybe you get blood tests. No, they'll send you to the lab for blood, but maybe you have to get a mask fitting. They'll either you have to do a TB test. Let's see, occupational health nurses, you may have to, yeah, a mask fitting. They may have to spray some stuff, and you have this hood on to see if you have the proper mask for your fitting. If something breaks out in the hospital and you have to wear a mask, they do a mask fitting every year, and you can go from there. Let's see, occupational health, they do physical, so they, you know, you get your blood pressure. You also will get vaccines there. You may have somebody to do a little bit of a physical where they're doing stuff to see if their balance is good. You're looking up their previous history in vaccines, as well as, let's see, occupational health, they may do vision test. If you already wear glasses, they're still going to do a vision test. It may be something where you're holding a card within like an arm span to see if you can see them. Because if you can't see, then you need to come back with the proper glasses or contacts so that you can see. Now, out of these 140 something people, I need some more likes. I got 10 likes. I appreciate that. And remember, you can subscribe if you are not subscribed already. Now, number 2, we talked about that, and I said that older nurses can do this if they're starting fresh from nursing school. Is infusion therapy, infusion nursing. You can work that in a hospital. You can work that. Actually, you could do a little bit of that infusion with another role that I'm going to talk about, home care. You can do that where you can go to a patient's house and do it for home care. Now, when you do, well, let me get into home care later, because that's number 4. So number 2 is infusion. You can do it in a clinic, an outside clinic. You can do it in a hospital, and you pretty much making sure that you do the medications correctly. You know what's in there. You know if there are any, what do you call it? If there are any antidotes for the medication that you're given, you make sure that you know that, just in case there's somebody that is allergic to it. So infusion nurse is considered my soft era nursing position. And I've actually done a little bit here and there, but of course, working in the ER back then, you always doing the infusion, IV fluids, whatever type of drips, insulin drips, cardiac medication drips, you always doing them. So infusion nursing, that's a win-win. Now, number 3, school nurse. You're not pushing, pulling, tugging. It's not bedside. You are literally in an office. And one of my fellow travel nurses that I worked with a couple of years ago, she got a position as a school nurse. Now, full disclaimer, all of these positions may not be the highest paid because they are soft nurse jobs. So you're not doing a wear and tear on your body, but some of them are good paying. School nurse, on the lower end of payment, for sure. And of course, when you are a school nurse, most of the time you're in an elementary school, middle school, high school. But I believe the majority of the time it'll be either a special needs school where they have kids that may come with trachs. Maybe you're riding on the bus with them and make sure that the trach doesn't come out. If they need any type of medications, maybe the kid have a peg tube or something like that, you are the nurse that's going to administer that medication. If a kid comes into your office for a fall or a scratch, you make that determination if they need to go to the hospital. Of course, if a kid, and when I was younger, I actually went to the school nurse. Of course, I didn't think about being a nurse when I was in elementary school. Some people do. But when you go into the school nurse office, you got to use your nurse judgment. So if you don't have nurse judgment, I don't think that you should go into being a school nurse as a new nurse. If you have a year or two, it's perfect for you because you don't have to do a lot other than be there for the children that need you. So some jobs, some school nurse jobs want you to have an ICU background because of the trachs, just in case if, what happens if it comes out, how do you know what to do? If you need to suction the tube, if you need to suction a trach, you need to know that information. But if it's not one of those type of schools and they just need you to be there to, if there is a kid that needs medication at a certain time every day, Monday through Friday, you're there for that. If there is a kid that may have hurt themselves in the gym, like me, I literally hurt myself in the gym and I think I passed out. So when I woke up, I was in the gym, I woke up and I was in a hospital. And I was like, what's this? But if it wasn't for that school nurse saying, hey, we need to take her. Well, I mean, anybody with judgment would think if a kid, runs and falls back and hits their head and passes out, you need to call 911 or the ambulance or whatever. But now they have, school nurses that are pretty much in the majority of every school so that they can make that call, or if a kid needs medication administered, they could do it because they have that background. So school nurse, that's number 3. So I need some more likes. I appreciate, I got 15. I appreciate y'all for likes. But if you haven't liked the channel, please do. And make sure you're subscribed. And if you have a question in between when I'm saying this list, feel free to comment. I'm looking directly at my phone so I see all of the chats and I can reply back. Okay, number 4 is home nurse. Home care nurse, okay? So when I was saying the infusion nursing, home care nurses, that is considered a soft nurse life error, because depending on your patient, you may not have to push, pull, twist, all of that. As a nurse, you may have to just go in and give an IV drip. You may have to give, because I've done this, you may have to go in a patient's home to give an antibiotic. They're sent home to do antibiotics for 6 weeks, and they want a nurse to come in and administer it. Of course, they may not have a pump for the patient to have the antibiotics dripping, but that infusion, the tubing on the medication will have a roller dial. So if you know what a roller dial is, comment in the chat. I just want to know. If you know what a roller dial is, say I do, because I don't have to explain it if you know what it is. But for infusions, okay, cool. You know what it is. Anybody else know what a roller dial is? So for infusions, depending on what it is, if you've been a nurse for some time and you know how to kind of eye the drips, you can kind of just roll the, why am I going blank? In the tubing, there is a device that will control how much is dripped per minute, and you calculate it on how many drips per hour. Now, of course, if it's a bolus, you open it wide. If it's IV fluids, you just open it all the way up and it just flows through the veins. But with the roller dial, you can set how many drips per minute for the patient based on the doctor's orders that you're given. Okay, my mom was a home care nurse for many years. Really depends on where you live. Some patients can be high acuity. Yep, that's what I said. It does. It depends on your patient. I thought I said it. If I didn't, my apologies. It does depend on your patient, because when I did it per diem. I worked in the ICU and then I did home care on the side. So I did have patients where they just needed infusions. There was a patient, and he was a younger guy. I'll never forget him. He's sweet as pie. He was in a car accident, and was he was paralyzed from the armpit, yep, from the armpit down. So he was able to move his arms. Of course, his arms wasn't the best mobile things, but he could straighten straighten a shirt, or eat something, or press the remote buttons. But he was such a sweetheart, and we both had something in common. We both ran track in high school. But he was in a car accident, so I don't know the details of, them suing somebody, but the house that I went to was a nice house. It was in a very good area, and that house was in his name. So his family lived with him. He was well kept, well kept. And I would only come to him on the weekend. So when I came to him, I would actually, family would get him in a chair, and I would wheel him into his bathroom. He had a nice open bathroom. Of course, he had the biggest room. It was on the main floor. I would wheel him in. He would use the restroom first, so I would have to, put on a glove, put the lube on the glove, put a suppository in there because he couldn't really control his bowels, or his or straight cath. So his family was straight cath him because he was a younger guy. So of course he didn't want to be all exposed like that. When you're younger, you don't really want all of your privacy out there for, anybody, to be honest. You want your dignity, you want to be kept covered. So, the chair that he had was awesome because they would put him on a chair. I would put my gloves on, give him a suppository, wheel him back into the to the toilet, and close the door, give him some time. As I'm giving him some time, I'm kind of fixing his bed or whatever, and he would call and let me know, if he was, if actually, no, I would check in on him. And, of course, if you hear something in the toilet splash, it's that. But since he was paralyzed from the waist down, he couldn't feel if something happened. So I would give, let me see, don't stick things up there. Actually, I had to, because he had no, he didn't have any control of his bowel. So I did help him with that. And actually it was like it was not a suppository. It was a suppository, but it was more like a little fleet. What do you call it? It was like a fleet enema in a way. So I would give him a couple, and it would be water that would kind of help that to come down. Because usually, and you would know this, when you're moving around, when you're walking around, that's what helps to, burn calories and help to your bowels to go down. So being that he was not an ambulatory patient, he couldn't walk, he needed the little extra fleet enema to help various enemas. So that would help him to move his bowels down. That would help. And it was a couple of times where I had to do a couple at different times because nothing would pass, but usually it did. So with this patient, I would wheel him up and he would brush his own teeth. I would give him a shower. And, of course, for him, like I said, he was a young guy. So he would put maybe a towel over his area, and I would wash his hair. I would wash everything, as well as for him, he would wash his private area because, again, he's a young guy. He don't want no nurse rubbing on his junk like that. So he wanted to remain covered, and I understand because, you want to give people that privacy that they want. Even though he's handicapped, he still could do certain things. So I allowed him to do what he needed to do. And at the end, I would finish the rest, and then I would rinse him off. So, and then we would dry off. I would help him put on a shirt, and he would get back in the bed. I would put his boxers all the way up, but his sheet will be covering here. So I would kind of help to a certain degree, and then he could grab them and pull them himself, laying flat. So another thing I would do for him, and this guy was so sweet. and his family and the dogs. I would do range of motion. And I did the range of motion before we even got up to go to the bathroom, because being that you don't move, your body kind of jitters a little bit and it shakes a little bit. So his arms were fine, but it was more so his legs. So I would do the adaptation and everything, as well as, you know, he would let me know when he was ready. And it didn't take that much time. But anyway, with home care nursing, you really grow attached to your patients if you see them often. So, yep, he was one of them. But some of my patients, I would just go in to do antibiotic infusion. And I believe there was a couple of them I would just have to give them a shot, and that was it. It was as simple as that. But everybody is not simple. Some patients are not going to be the cleanest. Some patients are not going to, you know, you know, be as simple as you giving a shot or you giving an infusion. You may have to do total care on them. They may not have a live-in tech or nurse to help them with certain things. So when you come in, you may be, you know, but what I will tell you with home care, when I was picking up, they did give me the heads up of what was needed. Like, it was a guy that needed extensive wound care, and I didn't really feel comfortable with doing all of that wound care, so I didn't pick that case up. But there are patients that were a little higher acuity, but a lot of them that I picked up that weren't already taken were the ones where, okay, give them a shot. And some patients were super easy, but they were butt munches, okay? I'm just going to say that. They were butt munches. So they would be rude, and they would just be upset with life, and they would just talk to you any kind of way. And then what you do is you just, you know, refuse to take care of that patient when you were done. I took care of all of my patients, whether they were rude or not. But you can choose. Thank you so much, Molly. You can choose if you want to go back to that patient if they're being rude. Okay, let's get to number 5, because I talked a lot about home care. Nurse educator. So, of course, as a new nurse, you cannot be a nurse educator. You can't be that. If you think about, so you could do nursing, nurse education, actually 4 ways. But technically, paid nurse education, where you have a consistent income, you can, if you want to teach, if you're an RN and you want to teach clinicals, you have to have your bachelor's for that. You can do clinicals where you have a class of, I don't know how many, depending on your class, 5, 8, however many that is. You bring them to a hospital and you teach them what to do when assessing a patient. Learn your medications before giving it. What do you do before giving a blood pressure medicine? Stuff like that. Of course, you don't always think like that as a new nurse. In nursing school, as a student nurse, you don't think like that. But you can teach oncoming nurses what to do before seeing the patient. So clinical instructor, or they call it a adjunct instructor. You can do that for LPNs. You can do that for RNs if you have your bachelor's. In order to be a nurse educator in a hospital or actually do lecture, you need your master's. You can be a nurse educator. That is something that I want to do. I want to actually teach in an actual school. I could do in person. I can do online. I could do both. But I would love to teach upcoming nurses, because they say nurses eat their young. We need to mold and help and nurture these new nurses, whether they're older than you, they're younger than you. We need to mold them to be the best nurse and to take care of patients like they're your own family. I've mentioned a lot of times in my shorts, because I do a lot of shorts. Here and there, I'll do my lives maybe every other weekend. And, you know, it's a lot of bad out here where it's nurses aides, you know, and they're just treating patients any kind of way. And the only way that we know that, and people say, why is this being filmed? The only way that we know that is if it's being filmed. Back in the day, nobody filming nothing, nothing at all. But we'll see it if it's filmed, and some people, they're upset and they put it on social media. When it's, I got on the airplane for the first time. Awesome. Um, when stuff is filmed and they put it online and I see it, I share it because I want to give my opinion on it, whether it's right, whether it's wrong, and I want to hear your opinion. So a lot of my videos on my channel are reaction videos. A lot of you guys came from the video of the neonatologist that is from Egypt that saved the baby. I have 3 of them. He is awesome. I don't follow him on YouTube, but I do follow him on Facebook. When I followed him, I think he was close to 1 million. So in those 3 videos, I put his Facebook link in my description because I want y'all to follow him too. And I think he's at about 2 million right now. So big ups to him. But yeah, so nursing educator, a teacher, a lecturer, adjunct instructor, lecture, and actually you could do as an educator with your master's, you can teach in a hospital, you can teach in a school, you can do lecture for LPNs, for RNs. And a lot of RNs, what they do is they'll go to an LPN school and they'll teach lecture for them. Because you can't teach an RN with a bachelor's the master level of nursing education. They want you to have that master level. And then you can, I said 3, maybe 4. You could be a nurse mentor. That's an educator in a way, where people can pay for your services and you can kind of like be their mentor while you're working. I have a mentor myself. I don't pay her because she's family, but she has been a nurse for over 40 years. And whenever I have issues, that is my go-to. And also, like, you could teach on YouTube. You could teach certain things that you know on YouTube. And if you're monetized, you get paid doing that. So nurse educator is something. I teach a little bit of nursing here. I haven't even clicked the button to monetize my channel. Yeah, I know I'm crazy. I got 135,000 subscribers. And I haven't even clicked on it to be monetized yet. I really haven't. I'll do it maybe next month. Who knows? So number 6 is a public health nurse. So with public health, these are jobs where you may work in a underserved area, or you may be at a facility and you may be, well, most of the time it's an underserved area. If not, correct me if I'm wrong. And hold on, wait, let me look at these chats. I'm missing them. Okay, so Sunbright Films, hopefully you are no longer stuck in Tulsa. Well, hopefully you don't get stuck in Tulsa too long on your way to Miami. And I'm jealous because I need to have a vacation myself. I haven't been on a vacation since 2019, before the pandemic, because my husband and I usually take a cruise every year. And we just haven't gotten back to it. Maybe we'll do something later on this year and get back to our cruises next year. Who knows? Ruthie Hill. Yes, I'm an educator. Is what yes, a nurse educator is what I want to do. Okay, Ruthie, because we both want to do this. Ruthie, we both want to do this. Do you want to teach lecture? Do you want to be a clinical nurse instructor? Or do you want to do education in a hospital? Let me know, Ruthie. And then I'll get into the public health nurse while you're writing me back. And Ruthie, are you currently a nurse? If so, what area are you working in? And out of the 133 people, I need some more likes. I appreciate those 26. But give your girl some thumbs up. Okay? Those are free. And subscribe if you have not subscribed yet. Sometimes I talk too fast and my mouth don't move as much as I want it to move. So apologize for that. I'm human. Okay? So public health nurse, yes. So you go in and maybe you're getting updated vaccines. Maybe you need to, when I think of public health, I think of a free clinic, the free clinics, where you need to, get testing done, maybe STD testing, maybe a pregnancy test, get updated vaccines, get blood drawn. If you don't have a primary care provider, you can go in this walk-in center. That's what I get the vibe of, walk-in center. If I'm incorrect, correct me in the comments. But public health nurse, I think of walk-in centers where you're there to help them and give them whatever they need so they can get a prescription and for whatever their issue is, and they can go get it filled. Usually it's a building that has everything there. Like in Michigan, a Herman Kiefer. So you can go get your, if anybody is watching in Michigan, you know what Herman Kiefer is if you're in the metro Detroit area. You can go and you can be seen. And most people think Herman Kiefer is just about STDs, but it was about you getting care there. It was a pharmacy there. There was a WIC program. So if it was a mom that needed assistance with her babies, you can sign up for WIC. So that's what I think about a public health nurse. I've been talking about, let me just drink a little bit of water, and then we're going to talk about number 7. Okay, so number 7, nurse informatics. So with nurse informatics, actually, there are a lot of jobs for informatics that I've observed. You're doing, well, all of them, you're doing data. You're looking at a lot of data for things. So example, informatics was a big thing during COVID. When the height of the pandemic started, there were informatics nurses that were looking at the data for the vaccines, the increase of COVID in each state or in each city in their state. So that was something that informatics nurses do. Of course, you have nurse judgment. You can't be a brand new nurse going into informatics because you need to know what to look for. But now they have master's programs for nurse informatics, and you can go and get into that if you want. And it's no bedside. It is strictly computer. Look, it is strictly computer data that you're looking at in research. Okay, so number 8 is case management. Now, case management is not for the new nurse, but it is definitely a soft nurse era, because case management, you do not do any bedside. You don't do any patient care. What you're doing is you're helping the patient, whether you're in, because it's different areas of case management, and I'll go over it. So with case management, you're pretty much, if you're in a hospital, you're doing discharge planning. Okay, if you have patients that are waiting on particular tests, and they need to be discharged in a certain amount, because hospitals, let's just pause. Hospitals is nothing but a business. Okay, it's healthcare, it's patient care, but it's a business. They want their money, and they want their money in the time frame that their patients are there. So if their patients are there beyond the time frame of what their insurance will pay, they want them out. Okay, they want them placed somewhere, whether they're going back home with home care, whether they're going to a skilled nursing facility because the acute has been fixed, but they need to go to another location to help build that patient back up. Maybe their mobility has diminished and they need to be with physical therapy for some time. Or if they need infusions done and they live at home and they need them done every 3 hours, and they don't have the help, then they'll go to a skilled nursing facility to get that done. Or if they are in the ICU and they're not doing good enough to go to a step down unit, those patients will go into a long-term care facility. Okay, so I've had a couple of videos where you see skilled nursing facility videos, as well as I think my long-term care video hit about 1 million views where it was a travel nurse. Okay, big up to the travel nurses because I did that for 3 years. And every time I see these contracts, I think about going back. But like I said in the other video, I got to do something first before I can get back into that, because the money is still there. It's just not as much as what it's used to be. It's not as much as what it used to be. And it's still contracts out there. So we can talk about travel nursing if you want to. You can comment, but I'm a finish going over this. And I did travel case management, by the way. So what you can do with case management, you doing the discharge planning, right, in a hospital setting. You also, when you're doing case management, you can do it with an insurance company. That's number 2. So major insurance companies, Blue Cross, Aetna, Molina, sometimes CVS. Well, not sometimes. It's CVS remote case management jobs. It's case management jobs where you even work from home. Okay, I've never done a work from home case management job because I don't know. I think the work from home jobs don't pay as much than the ones where you go into a hospital. So case management, you can do discharge planning. You could do, oh, it's another umbrella of case management is utilization management. And that's more of the insurance side of the numbers, how much this is, how much that is. In some positions, you have to do both. But as a new grad, you can't get into case management because they want you to have your nurse judgment and you need to know some stuff outside of the books to get into case management. Most places, they want you to have 3 to 5 years experience, but now since it's been some time where they're just short and they need people, they may give it to you. They may let you get into it after 2 years. Hey, Selena. But not as a new grad. No, you need to have your experience. Oh, okay. Hello from Germany. Let me see. Okay, Ruthie. All right. You want to do lecture and get my DMP. I'm working in schools where I'm over 6 schools, monitor clinic staff, and attending meetings. I am also a hospice, case manager. I do a lot of patient teaching. So yes, and that's why I said you can't be a new nurse doing case management, because you do have to educate patients. You're doing discharge planning, but you're doing education as well. Well, all of nursing, you're doing education. Selena, nobody deleted your messages. I didn't, because I'm not even on my laptop to see it. It looked like the messages were retracted. But I did see that you said hello from Germany. So I said, hey. You said you can't fit much in the comments. Okay, but yeah, so you do patient teaching with any role as a nurse. Any role. So 100% education. When you want to get into education, it should be second nature because you already are teaching patients, but now you're going to be teaching nurses. You may be training nurses to do certain things in their area, and that could be helping them to teach patients what to do when they get home or while they're in the hospital. So 100%, let me go back to the paper because I did move this over to the side because Selena's messages were getting retracted and I didn't even touch them. So I don't know about that. But yeah, case management. Yeah, you definitely need to have some nurse judgment there. But once you get your time and you want to get away from the bedside, case management is pretty decent. Have a good day. May God bless you guys. By the way, I'm a nurse too. Okay, good, Selena. Thanks for sharing that. Yes, so case management, a lot of people don't want to be in a hospital anymore. They want to relax at home. They want to be able to relax and talk to people in the comfort of their home. Don't want to, okay, bye, Selena. They don't want to burn any gas to go anywhere. They want to just, I don't know how your messages are being deleted. Selena, I don't know, are you subscribed to the channel? Because I don't think I'm deleting, I don't think there's any things that allow you not to to comment, because you could just shut off people that are not even a part of. You leaving? Oh, other child.
And it takes 31 minutes on the street, 28 on the freeway, and the freeway is 20. It's like half more mileage. So I'm just gonna take the street.
Okay. All right. Be safe. Okay. So with case management, you know, some people just don't want to go. They don't want to burn the gas. They don't want to do anything. Let me see. Okay, I think I will. Oh, you're not bothering me. Okay, there's somebody from Russia. I don't know how to pronounce your name. And here go a pink wave. Thanks for the pink wave. But yeah, so that's a flexibility, but it depends on your job. Now, insurance companies, hello, insurance companies will allow you to work from home. Some of them, some of the major insurance companies will give you a setup. They won't give you a MacBook, but they'll give you a computer. They'll give you a headset where you can call and talk to your patients, but you have like a quota that you have to reach. So be conscious of those, because you may have a higher volume of patients. When you're in the hospital, you may not have to call 100 patients a month. You may have 100 patients within a month that you take care of, but you're not calling each individual trying to do some type of plan. So, yes, case management is something that I did travel and do, but I only did it in the hospital for discharge planning. And yes, it paid pretty decent when I was traveling. The most I've gotten from a travel case management role was about $4,100 a week. So, and I think I was getting paid more than the bedside nurses at that facility. So, it is what it is. That was a couple years ago, but I'll never forget it because that was one of my higher paid contracts. Okay, so number 9, clinic nurse. So clinic nursing, it could be you working in a doctor's office. Most doctor's offices want medical assistants over nurses because they don't have to pay that much for a nurse. Most nurses want to get paid anywhere between $30 to $50 an hour. And if they could cut cost, because I was at a doctor's office and I loved it there when I was a phlebotomist, but when I became a nurse, they didn't hire nurses because they probably didn't want to shell out that money. They'd rather pay $20 than $30 to $50 an hour. So, but it is what it is, because doctor's offices usually just flow better with the medical assistant, the medical billers, because the medical assistants can give shots. So it flows perfectly. In the place that I worked at, it was perfect. I mean, we had so many doctors. It was all females that I worked with. Nobody was catty. We was all cool. We went out to eat. We had Christmas parties, all of that. It was amazing. I'll never forget it. Okay, let me see. Tip Tops. My wife works with Blue Cross. Oh, so she works at Blue Cross Blue Shield of Michigan. Okay. She has her master's, okay, in social work and deals with hybrids. Oh, nice. Okay, so definitely Blue Cross. I actually had an interview with Blue Cross Blue Shield of Michigan a while back, but it was they wanted me to do a 6-month contract, and this was during a time where I was still traveling, and I'm like, 6 months, and the rate was like regular staff rate, so I'm like, nah, I'm okay. I just continue to travel. But yeah, so that's awesome. I know that each area of Blue Cross has, well, any insurance, they have certain areas where you're dealing with different patients. And depending on what your background is, they'll put you with trauma patients like me, ER, ICU background. They'll put you with trauma patients, or I was a dialysis supervisor. They may put me with dialysis patients because I know it. They're going to go and see what you are suited for. And then if you're just pretty much okay with anything, of course, you'll get trained to take care of all of them. Okay. Yes. So yes, Blue Cross Blue Shield works from home. So I'm sure Tip Tops that she had her whole setup. I think some places when you work from home, they want you to have a locked area because it's a HIPAA violation if you have, the computer with your patient information and it's at home and it's out in the open. Anybody can open it. And of course, I know they micromanage everything that happens with the computer, but you also, what? You're not trying to be funny. I got a booger in my nose. Okay. If I got a booger in my nose for real, let me know. But I do got gray nose hair, so I doubt it's a booger. But if it is, let me know. I might have one, but I ain't gonna dig in my nose, so it's just gonna stay there. J Meal. But that's funny. If it is, I'm gonna really be embarrassed when I look back at that. Cause really, my phone is here, so I can't even see nothing. So if I'm doing like this, I don't see nothing. You tripping. You playing with me. Ain't no booger in my nose. You got me looking at the recap on my video. But anyway, okay, anyway. So let me get back to this because y'all got jokes. And it was funny, so. Okay, thank you, Ruthie. Okay, appreciate that. People trying to crack jokes in the comments, and I fail for it, but it's okay. So clinic nurse. So when you're working in a clinic, that is considered extra soft nurse era to me. But if you are working in a clinic and it's multiple providers that's there in one day, and you're short staffed and you have to do everything, because I've been in this situation, where we'll see 100 patients and it's 2 nurses and it's 2 techs. And what do? Because you want to make sure that you're doing everything you're supposed to do. You get out on that floor and you help. This is just me. You get out on that floor and you help your nurses' assistants to get vitals, to do intake, because we're a team. But days like where it's a light day where we only have 10 patients, you sitting at your desk doing this. Twiddling thumbs. Okay? Twiddling. So, clinic nursing, depending on where, because you could be at a chemo clinic. That could be busy it depends on the place. If they just piling patients in because they have to be seen and then they go to infusion after, that could be really busy. But like, let's just say postpartum follow-up clinic, something like that. Usually when you are in a clinic and you have multiple providers, usually the nurse is assigned to maybe 1 or 2 providers, not all of them. In a perfect world. The situation that I had been in, I was assigned to about 9 of them. But I mean, I juggled what I had to do. I'm good. I mean, my check was still coming. So, because I know when it's a light day, I'm twiddling thumbs. Me and the schedulers trying to figure out what we gonna eat. Because I eat out on Fridays with them. I don't do all that extra stuff. During the week, I try to eat my healthy stuff. And then I'm bad on Fridays. But it is what it is. Okay, let me see. Our contract positions that much different from direct hire. She was direct hired and probably should have asked. So contract positions, you just discover the lie by scrolling. You teach us English. I talk about nursing. I speak in English, but I don't speak any other languages to translate into English, if that's what you're asking, Muhammad. Okay, so tip top. Yes, so contracts can be different when 100%. Now with Blue Cross, I'm not 100% sure because their contract it seemed lower to me. It seemed like you were getting paid the same amount. But I think with Blue Cross, and correct me if I'm wrong, tip tops, the insurance is either free or is little or nothing. When it comes to Blue Cross, when you're getting your medical. Let me know about that. Sierra, pros and cons to working as a phlebotomist. I got you. I miss being a phlebotomist, to be honest. But tip tops for the direct hire, you just getting whatever the hourly wage is that they want to give you. with a contract, they tend to pay contractors more to be enticing. And when you work for so many months and they try to hire you in, sometimes that hire in, they'll show more benefits, because when you're contracted, there are no benefits. There's no insurance. There's no 401k, or none of that. None of it. When you're contracted, you just getting whatever your weekly or biweekly rate is. No benefits. So when you get hired in, they probably make it seem like, oh, it's so much better because, hey, for example, you get free insurance, or you get low paying insurance, and but there's a pay cut of a couple of dollars. So it's definitely a difference. I'm conscious about dry lips, so I'm sorry, y'all. It's definitely a difference from contract to direct hire, and usually it's with the pay, and definitely with the benefits. Okay, so let's do this phlebotomy talk. So phlebotomy was when I started as a phlebotomist in 2008, and that was the start of my healthcare journey. Okay, so the pros of phlebotomy is, if you're not, I'm sorry, okay, tell me if you're thinking about phlebotomy, Sierra, or if you are just trying, say you're a medical assistant, you're just trying to go into the phlebotomy portion of being a medical assistant. Let me know that first, so that I could give you a little more tips on the pros and cons of working as a phlebotomist, because it was all pros for me back then, because let me see. For me, it was all pros, because I was good at what I did. I was good with that needle. I enjoyed doing hard draws, and hard needle sticks. I worked in a clinic where they were X-drugs users, and I would have to thank you for liking my face. But there were drug users, and I would just go in. They would show me where. Thank you so much for loving my hair. Actually, at the beginning of the video, I mentioned this morning I had ran into the rain because I had to take my dog out. So it's a lot fluffier than what it's used to being. I probably need to roll it up later on to have a crispier look. But thank you so much anyway. I try to rock my natural, but the humidity won't let me be great always. Okay, so you thinking about phlebotomy. Okay, so if you're thinking about phlebotomy and you going into, do you want to go to a trade school, or you want to go to a college to get your phlebotomy training? Hopefully trade school, because colleges will prolong it beyond what it needs to be. You can be in college for 9 months to get a certification you can get in 8 weeks, like me. I got my phlebotomy certification in 8 weeks. So make sure that you go into, of course, an accredited place where you can get your certification. But the pros for phlebotomy is you can work in a hospital, you can work at a doctor's office, you can work, even if you don't want to do blood work, going for phlebotomy, you can have the title of a lab assistant, and you can work at, say, everybody probably know about Quest. If you're in Michigan, I know Quest is something in Michigan. Quest Diagnostics, they'll hire you to draw blood, they'll hire you to process blood. So say you want to go for phlebotomy to get a trade, to get your foot in the door for healthcare. I don't know if that's your situation. It was mine, but I don't know if it's yours or not, so I'm not going to assume. So you get your phlebotomy training, you apply. And now back when in 2008, it took a long time for me to get in the hospital. I kept applying. I was working somewhere else, but it took me 9 months to get into a hospital that I live right across the street from. But when I got in there, I stayed in there for 8 years before I got into nursing. So definitely it's a win-win, because you can draw blood. If you don't feel comfortable, you can be the person that when you getting blood, you put blood in a centrifuge, you spin it down, and you take the serum off the top, and then you send it down the line, and you let another department to read the test. it's so many areas in phlebotomy that you could do, and you can get that certification pretty quickly. I didn't take my testing for it, just my schooling was enough, and it was a win-win. I would say maybe the cons is the pay is pretty decent. I would say it was pretty decent back then, but I think you get paid more now, because in 08 I got $11 an hour. I don't know what the hourly wage is now, but that was 08. $11, and I had 2 kids, okay? Not my 3 now, but I had 2 kids back then that were smaller. And yes, $11 was my starting rate. I think it was other places that paid maybe 12, 13. I don't know what it is now, but as time goes on, your amount increases. And again, I'm going to say this. As a phlebotomist, you are, and I've said this in another video, not in this one, but as a phlebotomist, you are the heart of the hospital. Reason why, if you're in a hospital, reason why doctors need to know what's going on with patients, and the way that they know what's going on with patients, if they can't see with the naked eye, is through blood work. So you drawing the blood, or you spinning it down and taking the serum off the top to send down to other people. I'm going to get to that, Liam, what a phlebotomist is. For other departments, medical technologists to read, or hematologists to read the different testing, this is what helps to treat the patient. This is how you know, and I'll talk about it now. What a phlebotomist is somebody that draws blood. So if you are afraid of needles and blood, this is not for you. But you can also work as a lab assistant. In hospitals, you'll hear lab assistant. Maybe not always phlebotomist, but lab assistant. So what the lab assistant can do, or I've heard of health tech. You draw blood and you send it off to the lab. You may have multiple patients a day, but you're drawing their blood and you taping them up and you sending them on their way, right? When you're lab assistant, you are, okay, cool, you got it. When you're lab assistant, you can draw blood, or you can process the blood and sending it over to another department. You're not actually doing the test yourself. You are just separating the blood to make it easier for the other people to actually do it, to read the test. Okay, let me go back to the cons. I would say was probably just the pay. Of course, you're not going to get paid top dollar for something that you only go to school for a few months for. You know, usually in healthcare, let me say in healthcare, I'm not going to say in general, because it's people that go to real estate school and they make millions, and they don't go to school for 4 years like a doctor would to make a good amount of money. They get their millions based off of commission sales. So in healthcare, usually with healthcare, the minimal amount of time you go to school, you're probably going to get paid the lowest amount. And that's my opinion. If it's different, correct me if I'm wrong. But the minimal amount of time, because I did the minimal to be a phlebotomist, I got paid $11 back then. Of course, it's probably going to be more now. I think one hospital that I worked at in the past, they brought everybody's hourly wage up to $15 to start. And that was the people that clean the bathrooms, the people that work in the cafeteria, the people that were medical assistants. If they weren't already up to that level, everybody got brought up to $15 an hour. And that was maybe 3 years ago. So yeah, that would be the only con. Oh, you have to be careful though with needle sticks. So never rush to get somebody's blood and then you mess around and poke yourself. Hey G James, thanks for waving. Hopefully you gave your girl a like, a thumbs up in this video, and you're subscribed. Everybody that's watching, hopefully you're subscribed. I speak English, not Spanish, Jackson. Unfortunately, I'm fluent in English. I only know a few words in Spanish, and my kids know some words in Spanish as well, but not fluent. But yeah, that's another con, Sierra, just to watch out for the needle sticks. And I mean, that's in nursing too, because when you're giving a shot, you don't want to rush and then something happens and something scrapes up against your hand or your anything. Even if you have gloves on, because then you have to go and you have to get tested for things and take prophylactic medications to make sure, and you got to make sure you look at the history of the patient to make sure they don't have, you know, in other words, HIV or hepatitis or something like that. That's some things that they look out for. Okay, so let me get back to these comments. I'm gonna look here on my laptop because my phone has scrolled down a little bit. Okay, the center where I volunteer posted a paid training program, but awesome. Okay, so you already working for the center, Sierra, and they're offering paid training. So that's a win-win because they'll probably pick you first over somebody on the outside because it's easier for you to transition into when you're done with training. It's easier for you to transition in when being a phlebotomist already in their system. It's a lot of paperwork and background checks and all of this stuff that hospitals have to pay for, and they love when you transfer within than to leave. So that's perfect. They're paying you. Hopefully, well, usually when it's paid training, it's full time. It's like a Monday through Friday, and you probably know the details, but that's a good thing. That's a good thing. I don't know. I think there was a paid pharmacy tech thing in Michigan that I told my daughter about, but she's going to school. She told me she was thinking about nursing. So she's going to school and she was thinking about having a trade while she's in college so she can work on maybe the weekends. And then when she's done with school, she can work as an RN and pass boards and stuff like that. If that's still her case for nursing, perfect, because she told me about two different things she wanted to do. She wanted to do a neonatal nurse practitioner, or she wanted to work in mental health. So yeah, that's perfect. That's perfect for you because they're paying you, number one, and you just go right into the system and be a part of them. Now look at what the stipulations are, because when they pay you, usually it's some type of contract there for you to stay with them. And if you stay with them, you don't have to worry about paying anything back. But if you quit, they're going to want their money back. They're going to want you to pay something, because the pharmacy tech position that I saw for a local hospital around here, it was the same concept. They didn't say how much they paid unless you enroll, but they pay you. It's a Monday through Friday classroom thing. You work in the hospital with someone, and when you get done, they have enough stuff set up to where you are board certified to take your test and pass. And then you have to apply still, but this didn't allow my daughter, to work part-time. You would have to work full-time. So you can't do that and go to college. She wanted to go to college for something else. She just wanted to trade. So look at the red tape in that and make sure that if you sign up for that, that you want to stay with that facility for at least probably a couple of years. They probably gonna want you to stay for 2 years. Okay, so I'm not even gonna read that, John Pork, but thanks for commenting. Anyway, so like I said, clinic nursing is a soft nurse era position. Now, number 10, nurse administrator. Now, this is not for the weak. It's not for the weak. If it's anybody on here that's been in management, I've been in management. You are working with not the bedside, but you're working with individuals that have all type of different attitudes. Some are easygoing, some are hard to deal with, just because, thanks for that. Just because they don't like management, or they may not even like you because you're in a higher position telling them what to do, and they just don't want anybody to tell them what to do. And don't be younger than them. They really hate that. But It's soft nurse error because sometimes it can be easy when you're in a certain environment. Now, say a hospital administrator, no, you dealing with a whole bunch of stuff. Maybe if you're working over multiple clinics, it can be easier, but like let's say dialysis clinic. Say you're an administrator of 3 clinics. So you're over nurse administrator, you're over the nurse managers. So you're looking at what needs to be done for your clinics, but you're reaching out to your nurse managers at each clinic. You're not worried about everybody underneath per se right away because that's your nurse manager's role. Now, if they don't do their portion of what needs to be done, then you may have to have some type of corrective action with that nurse manager that's over your area that you're overshadowing. But if everybody does their job, a nurse administrator in a smaller role could be perfect. It could be perfect. I can give you an example of something that is probably easy to get into, but I don't recommend anyone to get into as a new nurse, let alone Brittany. So I'm talking about the soft nursing era. I already went over, well, I'm down to 10. I already went over 10 different things, but soft nursing, yes, less stressful nursing careers. And if I didn't cover anything, comment something in the chat. Okay, I don't know if you started off in the beginning. A lot of you probably didn't, but I can recap really quick. Occupational health nurse is my number 1. Infusion nursing is number 2. School nurse is number 3. Home care, but that depends on the patients that you have, because some of them can be a lot, okay? Nurse educator, public health nurse, nurse informatics, case management, clinic nursing, and nurse administrator is what I'm talking about. Now, like I said with the administrator, it's not always less stressful. It's no bedside. It's no pushing, pulling, twisting. But if you have a good team, your job could be as easy as just making sure that your staff, your nurse managers are, or your nurse supervisors are taking care of what they need to do, and they're just giving you the numbers. So you make sure that everything falls in line and the budget is perfect and stuff like that. It's not always going to be easy in management as a nurse, because it wasn't easy for me. Because my story, if you want me to tell you my story, I will, but my story was a little bit different. How I got into the role as a nurse supervisor, but I was actually managing the clinic. Okay, number 11. After this one, I'll open it. Okay, you missed the first 9. Did you hear, Tanisha, did you hear all of what I just read out? I think I went over all of them. Oh, okay, cool. Okay, 11. After 11, if you want to open up to talk about anything else, you can. If you want to share an experience with nursing or things of that sort, you can. But number 11 is a nurse researcher. So you know you ain't doing no bedside with a nurse researcher. I think researcher and informatics give me the same vibes in a way. But with research, you're researching specific things. Now, you're looking at the data. That's why I say it's data, just like nurse informatics, but you're doing research, and it could be something as simple as the outcomes of patients with blood pressure medication that's on Carvedilol or something like that. You know, it depends on what your research is on, and you know 100%. I'm sorry, I can't sing. Thanks for saying my voice is amazing, but I can carry a couple tunes, but I'm not going to embarrass myself on my live. But yeah, so research, you're not doing any bedside. You're pretty much not even doing, um, you're not doing patient care at all. You're just looking at what needs to be researched, pulling the data, getting feedback, looking at patient, or what do you call it? Not patient, but evidence evidence-based practice, stuff like that. But you definitely, that's soft nurse error, because you probably could do that at home too, unless you have to do something in particular at the facility where you have to look up something and you only have to be at a facility to do it. So let me look at some of this stuff here. Okay, Brittany. Thank you. I don't mean to interrupt, but I'm a CNA right now, but I would like to be an RN. Okay, awesome. So Brittany, let me see, what type of nursing would you like to do? What area of nursing do you want to be in? Do you want to do like mother baby, labor delivery? You want to work in a trauma area? You want critically ill patients? Do you want to do pediatrics? You love to work with the babies. Do you want to do med surge, where you see a lot? Because I mean, med surge, you see a lot of med surge. I'm not even gonna lie. I mean, with nursing school, we had to do 4 rotations of med surge, but I just knew that I didn't want to do it. I wanted to see more of the trauma. So that's why I got into ER. I wanted to see everything under one bubble, because a lot of people that come in the ER, not all, but a lot of them do not have a primary care physician. So they're coming to you and they're getting stuff done. Maybe they having a heart attack, or maybe they're having um, shortness of breath, and you're trying to figure out what's going on. They may be diabetic and never even took anything for their diabetes, and they need referrals for things. Now, everybody don't follow up. Everybody does not follow up with the referrals that they're given in the ER, or probably with a lot of things. That's why they end up in the hospital. But you try to, in nursing, you try to drill the education into the patient. Hey, you want to have a stroke next time, your blood pressure is through the roof, 200s over 100s. Or what I'll say is, have you had a stroke lately? And they'll look like, what you mean? I ain't had no stroke. Well, you're going to, if you keep up with this. You need to take your medication. You need to change your diet. You need to do X, Y, and Z. And sometimes you have to scare patients to get them to do what they need to do, because you care. You want people to strive, but you also want them to listen and take their life seriously. But yeah, Brittany, med surge. Okay. So med surge, yes. When you go to school, you're going to have multiple rotations in med surge. You're going to probably, it's different parts of med surge. Why am I even stuttering? I'm talking too fast. It's different parts of med surge that you're going to see in your rotation. And, you can see people that had surgeries. You'll see, we've seen a lot of bariatric surgery patients. We've seen people that had surgery, people that just had stomach issue. You see everything in med surge. But I wanted to see, what they see on TV. Like coming in, people got a knife stuck in their stomach and they screaming and all of that. But that was just me. I got my feel for the trauma. And that's, a lot of people like for you to have a trauma background. Of course, my mentor told me when I get done with school what to get into, because if you want to move up the ladder and get into maybe management, or say you just don't want to do the bedside anymore and you want to have that soft nurse era, those places that are hiring you want you to have that already in your background. So it's good to have med surge, Brittany, as well as some type of critical care or trauma, ER, ICU. Unless you want to just stay with the babies, I love little babies. But labor and delivery, I couldn't do it if it was, somebody lost their kid. All right, I'm going to read yours, Jocelyn, in 1 minute. Let me just drink some of this water because I am continuing to run my mouth. as we do on lives, right? Okay. Self-love club. Gotta love yourself. I just wanted to put that out there. Okay. Okay. No problem, Brittany. You're welcome for the advice. And hopefully you gave your girl a thumbs up in this video and you're subscribed to the channel. Okay, so Jocelyn Tiffany. Hi, I started my preceptorship in the ER, and the one I'm at is crazy. I feel very overwhelmed. I want to be helpful instead of constantly asking how to do things, getting in the way. Advice. Okay. So, Jocelyn, in the ER, I guess it depends on your preceptor, because I've precepted a little bit in the ER. And what I tend to do is I ask my preceptee, what do you know already? So I don't know how they're doing it with you, but the ER is chaos at times. And when I started off in nursing, I was on midnights. So it would be chaos coming in at 7, and then it'll dwindle down, and then it'll be cool, calm, and collective. And then you sleepy, and then you look around and it's time to go. But you have to ask, if you're not asked what you know, if you don't know something, do not be afraid to ask. If you are being precepted in the ER and your nurse instructor is there and you're not asking any questions, they know, number one, you're not engaged at everything there. Now, if they get flustered on you asking the questions, let me know. Jocelyn, if they're flustered on you asking the questions, comment yes, they're flustered, or yes, they are, or no, they're not, before I even get into that. Because when you are precepting, you automatically know that you are showing someone, no, they're not perfect. You are doing what you need to do. Do not feel bad because you're asking questions. We want you to ask questions, because when you're on your own, you still can ask questions, but a lot of times you're going to be in a room with a patient and there's going to be nobody else in there but just you and a patient. And that patient is going to expect for their nurse to know certain things. And if you don't know, it's okay. You can just say, you know what? Let me go ask a coworker, or let me go ask the doctor. Now, you don't want to bombard the doctor with small things that you should already know, meaning asking the questions during preceptorship. That's how you know the things when you're on your own. Now, if you don't know and you in a room with a patient, just say, you know what, let me get back with you. I'm not 100% certain. The patient should respect that you are not going to lie to them and just wing it. And maybe you go to a coworker and say, hey, X, Y, and Z, how does this work, or how does this go? And then you come back and say, oh, I double checked with someone. This is what's going to happen. This is what we're going to do. But if it's something where you need to ask the doctor, feel free to do so. But don't ask the doctor like nursing stuff, because they're going to look at you kind of weird, because you should have asked those questions during your preceptorship. Make sense, Jocelyn? Hopefully it does. Anybody else that have any questions, feel free to comment. I'm opening it up for whoever want to speak about nursing or anything in particular, because I went over, you're welcome, I went over the 11 soft nurse era roles that I believe is soft nurse. And also I went over kind of like some people that's going to nursing school in their 50s and they think they're too old, and they're concerned about what type of job they can get into based on their age. Some of these you can. Matter of fact, for the older nurses that may be fresh out of school or going to school and they're done, if they don't want to work bedside for all of the rest of their life, because bedside can do a toll on your body. This is why people do not stay at the bedside. And if they do work in a med surge or labor and delivery, or they are not working full time, the whole 100%, without getting their bodies beat down. If they are, they're higher up. They're a charge nurse that doesn't have a slew of patients. They're just there to be of assistance to be of assistance and to give education to, you know, the staff that's there. Or they are in management. But it's no way that somebody, oh, I've been working on the unit for 40 years and they're in impeccable shape. They're not going to be in impeccable shape because the bedside will tear you down. So that's why they say it's a nurse shortage, because a lot of the nurses that work bedside don't want it. I'm one of them. But I don't mind sharing information to help the upcoming nurses, right? So like I said, I wanted to be in a nurse educator. I've worked as a clinic nurse. I've worked in case management. I actually did travel case management. I actually did travel clinic nursing. So I've done those. I've actually did travel infusion nursing. So out of this list of 11, for older nurses that are fresh out of nursing school, that want to get into that soft nurse era, I would recommend, because these, you cannot be brand new nurses with all 11, but I would recommend infusion nursing. Some people actually get into PACU. If you know what the PACU is, comment below. Say, yes, I know what it is. If not, no. I'll kind of tell you what that is. But occupational health nurse, if they allow it, I mean, you may have to have 6 months to a year experience. Jocelyn, okay, you know what a PACU nurse is. Anybody else know what a PACU nurse is? Infusion nursing, yes, you can get into that. They'll train you right there. But if you have a background already, say you were a tech and you've been putting in IVs, perfect. Infusion nurses for you. School nurse, I don't think they want you to have a lot of experience. Brittany, you don't know? Okay, I'll explain it in a second. School nurse, I don't think they want you to have a lot of experience as a nurse unless you're on the bus with the students and they have trachs and you have to ride on the bus to make sure. Hi. So here and there. Home care, I don't recommend that for a brand new grad, because you kind of need to know what to do in the home with the patient and there's no doctor. You're going off a doctor's orders. Public health nurse, you can do that. You know, you can work at a free clinic to give shots and stuff like that, and they'll train you on what you need to do. 100%, you could do that. Informatics, no. Case management, no. Clinic nurse, you probably can be a new nurse. You probably can. Okay. Rochelle, hospice nursing. Let me talk about that. Let me finish this list though. Clinic nurse, yeah, you probably could get into it as a new nurse. Nurse administrator, absolutely not. Not a new nurse. Of course, some nursing homes will offer you a DON position when you are a brand new RN. Do not do it. I think I was going to say this beforehand. Do not do it as a new grad, because you could be a DON and they offer you $80,000, $90,000 because it looks so good, when other DONs is getting paid over $100 grand, and you wet behind the ears. You just passed NCLEX. You just passed the boards. You don't know nothing. Don't get into that. Don't get into that, because you can set yourself up for failure. The state can possibly come. You can lose your license that you worked so hard for. No. As a new nurse, no. So nurse researcher, no. That's not for the that is not for the new nurse, the older new nurse, or the new nurse in general. No. Okay. So let me get into it. I did ask if anybody knew what the PACU nurse is. Okay, PACU. So post-acute care unit. Okay, so if you ever heard of OR nursing, you have surgeries. A lot of people say, back in the day, they would say the OR nurses were, those were the that was the area where nurses would go to retire. If you were done with the bedside, but you don't really have to use a lot of nurse judgment, and I'm not trying to put any department as you don't need to use your nurse judgment, but that was the saying back when nurses would retire in the OR because you don't have to do a whole bunch. Now with OR, there's pre-op, post-op, right? So you get your patients prepped for the surgery, and post-op is when they're done. They're out of surgery. Sometimes with the PACU, you would take care of patients that were out of surgery that maybe not they're not ready to go home. Maybe they have to be I just talked about the operating room, Vanessa. I'm talking about OR right now. Hopefully you getting this. Yes, OR is something where you don't have to critically think as much, but OR can be the soft nurse era in a way. Yep, it can be, because you don't have to worry about doing a lot. You just pretty much monitoring the patient, and hopefully everybody in the chat has gave me a like in this video and are subscribed, because I'm giving y'all free content, no ads. So hopefully y'all gave your girl a thumbs up and you subscribe to the channel. So let me go to Rochelle's hospice nursing. Now, I had a little bit of hospice nursing in my early career of nursing. And I'm going to tell you, Rochelle, I don't like it. I don't like it because the reason why I got into nursing is to help people get better. And when you realize what hospice is for, is, you know, it's like I felt like I was letting the patients down by being a hospice nurse, but that's not always the case. I was a novice. I was naive back then on hospice, but most of the time you're doing what the patients want. My patient that was hospice, when I was in the ICU, she switched over to hospice, and I was literally giving her morphine drip. That was her wishes. Her cancer had spread up to her brain and all over her body, so that was her wishes. And some hospice patients end up doing a 360. You know, they're in hospice and then they get better and they get discharged from hospice. Sometimes that's the case. Not always, but I got into nursing to help them get better and be discharged and go home. Not home with the Lord, but home to their resident. And their residents, or, you know, maybe get better to get the skills at a facility so that they can go home to be independent again. Now, hospice nurses, some people love it. Some people love it because you are helping that patient to, you know, live their best life while they're here on earth, right? So if you need to give pain medication to make sure that they're not in pain, if you let them eat what they want to eat because they're already dying, you want to make sure that you're giving those patients a good last days. And for me, the lady that I had, I mean, I had her husband was there. He slept at the bedside. But what got to me was she was my patient before she flipped over to hospice. And just because you flip over to hospice and you're on another unit don't mean that they have an open bed. So that becomes your baby. And you have to take care of that hospice role. So the gentleman was there, and I think he was spending the night with her because I work nights. And I told him when she was transitioning that I would let him know. And he would wake up from his nap and he would give her last goodbyes and stuff like that. So I was glad that I was able to be there to help him to get his last goodbyes with her, and that she was no longer suffering. But I don't want hospice for myself. I don't see it at all. But you want to make sure that your hospice patients have their best last days. But it's not for me. So but what I did for the husband is I let him, let him know when her vitals were starting to decrease. So you still can hear, to my understanding, the patient can still hear you. So he said his last goodbyes and he loved her. He hugged on her. He gave her kisses. And, family came, and they have a certain time frame of when you can kind of see the patient, and then, then you have to put them piece of lint. Then you have to put them in some, a toe tag them and put them in a body bag and bring them down to the morgue. But it's a prep that you have to do too. So, I said a prayer over her, and I'll never forget her. I'll never forget her. And she was my only hospice patient that I had in the ICU. So, I actually had to talk to my mentor about it because she was heavy on me, but she let me know, hey, that was her wishes. You helped her to transition, and that's what she wanted. So it made me feel better, but it was like, no, I don't want anybody to die. I want them to live. That's why I'm a nurse. I want to help them to be better. But in some cases, that's not always the case. Okay, so let me get back to it. Rochelle, I have been in the medical field for a long time. I've worked as a CNA, an EMT, immediate med tech, or MAID tech, LTAC, so long-term acute care, and now working in ER for children. I will be an older. Rochelle, you didn't been everywhere, honey. You got this. So I don't know what area you want to be in per se, but you've already been, you EMT, so you already know how to, take care of trauma patients, critically, or quickly take care of somebody. You worked in long-term acute care. Girl, you good. So, let me see. Did you tell me, are you in nursing school now? I'm trying to look in the chat to see if you told me if you were in school. Okay, Julie, see, hospice is too depressing. I like living life. I agree. That's why I don't like hospice. But, it's not for me. It's not for everybody. But it's some people that love it because you help those patients feel loved and hopefully pain-free and in their last days. And sometimes people don't have that. They don't have family. So you are the family that they have to look forward to during their last days. You had them to eat their meals if they even want to eat anymore. Because sometimes when you're down to those days, you lose an appetite. You don't even want to eat. You don't. And you don't force it, but you just play some music. I don't know if you can do this, but you play music that they like. You want them to feel good while they're transitioning, pain-free, if possible. I don't want that. I don't want to be a nurse. No, I don't want that. Okay, so let me go back. But I made it sound really good, didn't I, for hospice? You want to really take care of these people in their last days and make them feel the best that you can. Hopefully I really sold hospice nursing, but I don't want to be in it because I want people to live and live another day. Okay. Thank you so much for responding to my message. Oh, you're welcome. I Eat People said hi. Hello. I Eat People. That's a funny name. Let's see. Let me see if I missed anything. Okay. So Rochelle, oh, it's Rochelle, that's you. You said it doesn't have to be. It doesn't have to be depressing. It probably doesn't have to be depressing. Look at this. Let me get my hair together, y'all. I'm sorry. It'll be together the next video. My short, whatever short that I come out with. Sierra. My mother-in-law has been working for hospice for about 30 years now. She loves it. See, people love it. People love it. It's just, maybe I had a bad experience. No, I really didn't have a bad experience, to be honest. I just, I don't want to help people transition into death. I don't. There is always going to be you come into the world, you're going to leave the world. But this young lady was young. She was not even 50. She was young, maybe late 30s, early 40s, to my understanding. She was young. And when I had her, she literally was up laughing with family. And then when she got her results back that the cancer had spread all over her body, she immediately was like, no. Well, I don't know her reaction because I wasn't there, but she went from laughing and joking with her loved ones and me, because I joke. I'm a joke nurse. I'll crack jokes with you. If you have the if you uptight, I'm professional. Have a good day. But if you have a sense of humor like me, we gonna joke a little bit. I just do that. I do that with everybody. So that's me. But yeah, so to see that from her going from joyous and playful and loving to just out with the morphine drip, dying, it just did something to my heart. I didn't want to be a part of that anymore. So, okay, let me look at these comments. You definitely get my, oh, thank you, Rochelle, for the like. Appreciate that. You're amazing. I appreciate that. You in Atlanta? I lived in Atlanta when I was younger. You said, haha, nursing is calling me. My heart is, my heart is full. I'm glad that it's hospice nurses in the making, because there need to be people that take care of others. And it's nothing wrong with hospice, but it's not for everybody. Just like the ER isn't for everybody. Labor and delivery isn't for everybody. So, is what it is. Brittany, thank you. Like and subscribe. Appreciate that. And keep me posted on your journey in nursing school. All right. Okay, Rochelle, RN, BSN. There were times when families need to know where their resources are, how to cope. It is. It is. And I believe when there is a patient that transitions, I'm not 100%, but I believe there is hospice nurses that may call. Usually when hospice is there is somebody to follow up with the family. It's not just they die cold turkey and it's nothing. There are hospice nurses that follow up with the patient. Especially when, well, in this case, she had cancer, so she wasn't donating anything. But what I will tell you is we did eye drops to preserve the eyes, because you can donate your eyes. So, there are resources that's needed, but 100% believe that hospice nursing that's in the hospital reaches out to the family to help with that. Okay, some tips you give for NCLEX study. Okay, Rochelle ain't playing with, okay, so you graduate in August, so that's around the corner. So what I'll say, when you're doing the NCLEX, because it's a time test, anything that's timed, it's going to make you have a little bit of anxiety, just a little bit. It's a time test. What you're learning in school is molding you to help for the test. What I'll say is, don't tell anybody when you're taking your test. Don't tell anybody when you're doing your NCLEX, because people are going to bother you, annoy you, and they don't even realize it. And you don't want to go up in that room where you have this time test that you paid this money for, stressed out, from family, from friends. If somebody worried about where you going, oh, I'm going to the library to study. Say something like that. Don't tell anybody what time you are taking your test, what day you are taking your test. If you have to work, take that day off and say, I have a doctor's appointment. Don't even say when you taking your test, okay? What I'll say is, for me, dang, what was the name of it? It was a DVD, not DVD, it was a CD-ROM that I put in the computer. My Mac don't even have a CD-ROM, but it was a CD-ROM that I put in the computer, and I'm telling you, some of those questions were verbatim on the NCLEX. Not all of them. It was maybe a handful. I was like, oh, this looked familiar. But what I did use was UWorld. If you're familiar with UWorld, UWorld was something that you can download an app for. I think they give you a free trial, so you can use that or you can pay for it. But UWorld was helpful. Mark Klemick, okay? Mark Klemick. He was good, okay? I believe somebody had emailed me his audio books for passing the NCLEX, and he helped with select all and apply, because when you take the NCLEX, if you haven't already been told, you are going to do a select all that he apply questions. And in the NCLEX, wait a minute, this popped out. Jansen, hold on. I got bracelets on my ears. You know people could wear hoops anyway. I'm sorry, that just popped out. I had to laugh at that one. Thanks for that comment. But no, for the NCLEX, that threw me off. For the NCLEX, it's a time test. You have, select all and apply. So all of the answers are going to look correct. And they're not. It's not going to be all of them. It's going to be something like, look for these key terms. This is what I'll tell you. When you're doing your test, they're going to say only. That word only, be real subjective on only on a test in nursing, because most of the time it's not only. With nursing, it's multiple things. It's multiple things. Multiple steps that you have to do. When you're taking a test and it says, what do you do first? What do you do first? You assess the patient. Always remember assess. You want to send me your information, Rochelle? In the description, I believe I got my email. You can email me. Or if you want to follow me on I got a YouTube, Instagram. If you want to follow me on there and DM me, you can do that too, but you can email me. It's all in the description. Okay? So definitely with the NCLEX, those answers, even the select all, the ones that's not select all and apply, multiple answers are going to look like they're correct, but you got to do the best choice. The best choice. Okay? So let me give you an example, Rochelle. So it's a patient that comes in to they're going to say the ER, because patients don't come into med surg. They come into the ER and then they're transferred to different departments. So a patient is coming into the ER with shortness of breath, feeling lightheaded, and have a blood sugar of, I'm sorry, not blood sugar, have a hemoglobin of, nope, I'm not gonna do hemoglobin. A patient comes in the ER that is short of breath. Their potassium level is 6.6. If you know what potassium is, the range of 3.5 to 5 units Thank you for that. Appreciate that. 6.6 is high. So they're short of breath, have a potassium of 6.6, and they're bleeding from a cut on their hand. What do you do first? So the question is going to ask that, right? Now, if you're a nurse, you kind of know a couple of things already from what I'm already talking about. We know that, and let me, this is for you, Rochelle, or anybody else that wants to answer it. I'm going to give you answers, and I want you to tell me what the answer is. And then I'm going to go over some of these comments, and then I'm going to come back to you when you respond. So, what do you do with the patient? A, assess the patient. No, because I already told you about assessing. So I'm not even going to say assess. What do you do first? A, get vitals. B, clean the cut and put a Band-Aid on it. Or C, give the patient oxygen. A, B, or C, what do you do? What do you do? They're short of breath. They have a potassium of 6.6, and they have a cut on their hand. What you taking care of first? Oh, cut on their hand, or you giving them oxygen? You said check vitals. Anybody else want to say what's going on? I'm going to give some other people some time, Rochelle, if they want to chime in. Okay. Hey, I was gone for a while. Could you tell me what you're talking about? So, Liam, I'm talking well, Rochelle was asking about hospice nursing, as well as I was talking about NCLEX, because she's graduating in August, and with her BSN, and she wanted like some little quick study tips, and I'm giving her like little key points to help. So I just gave her a question, like a fake NCLEX question. You know, the patient is, short of breath, potassium level is 6.6, have a cut on their hand, and what was the other part? Have a cut on their hand, and what do you do next? Or what do you do first? Do you check the vitals? Do you I forgot the order. Do you check the vitals? Do you give oxygen? Do you clean the cut? So that's what I was talking about. All right, let me look at some more of these comments, and then I'll go back to the answer. Sierra, I've experienced hospital care and I didn't realize it. I cared for my little brother who passed away from cancer. Oh, I'm so sorry. Last year, he was only 21, and I was in the room with him when he passed. It was hard. I'm sure it is, especially when it's someone young. It's someone young. It's hard when a loved one passes anyway, whether they're young or old, because my grandmother passed at the beginning of the pandemic, and she caught COVID, and that was hard because my grandmother was my girl. Okay. I still have a voicemail of her saying something to me, and I listened to it, and it's been 2-3 years. I listened to it. No, it's been 3 years. I listened to it the other day, like a month or so ago. Broke down. I broke down crying because that was my girl. Okay. All right. My grandma just passed. This past Tuesday. I'm sorry, Simply my ends too. I'm so sorry. I just talked about my grandmother passing years ago, and I'm sorry for your loss. I'm so sorry, because grandmothers are second moms. Okay. I feel so bad because she stopped eating and drinking, and we were begging her to eat and drink. She was in a rehab that sucked. Texting caps to see better. Oh, okay. So I'm so sorry that she passed away. She probably, when she stopped eating and drinking, it was what we call failure to thrive. So that's unfortunate. I'm sorry you had to go through that. Because like I said, grandmothers, those is mothers, those are mothers to your mother. So it's like mom number two. Okay. Let me pass that. Jensen talking about bracelets on my ears. Hopefully everybody in the live has given me a thumbs up and are subscribed, especially when I'm giving you free content, free help. Help your girl out. Okay. You're so right. Oh, I'm sorry, I skipped one. But through that, God taught me a lot about death, and death is hard, but I believe in heaven and God. I know that my brother is no longer suffering. Yes, and it brings you peace. Absolutely, because when your loved one is no longer suffering, you think about them going into a better place. So, you hold on to those good memories. You hold on to the good jokes, the good times. You don't want to think too much about the agony that they have been through because they're no longer suffering. So that's a good point, Sierra. That's a good point to bring out. Okay, Rochelle, you are so right. A lot of nurses that tested say the same. Not to tell anyone when you are, yes. Need that CD. You know what? I came across it in my basement when I was cleaning, and we had water in the basement, so it got damaged. So I had to get rid of it. I wish I took a picture of it, but what I will tell you, the NCLEX, there is a committee of people that write NCLEX questions. I would love to do that, by the way. I would love to do that. But there's a committee of people that write NCLEX questions, and the questions is thousands of questions, and they're on a rotation. So I think in 2020, I don't know if it was new questions that was put in a rotation. I'm not 100% sure, but those same questions for me, when I took it, is probably not going to be there for you. So it was just perfect because I saw a few questions that was already in my study, and it wasn't the UWorld questions. It was on that CD-ROM, and it was a older type of nursing book that came with a CD-ROM. Those they don't come with CD-ROMs anymore. You kind of just log into something and you download something. So, all right, let me get back to these. But yeah, Mark Klemick, I think you can look him up. I'm gonna put it in the chat for you, Rochelle. Mark Klemick. Look that name up. Look that name up to help you with your NCLEX, because he helped me a lot. And I think you can find him on YouTube. If not, Google that name. Google it. Simply the best. Yes, QR codes. Forget CD-ROMs. Most laptops don't even have CD-ROMs anymore. I bought my daughter a laptop to go to college. I don't even think it was a CD-ROM in that. Yeah, and we're not gonna talk about floppy disk and hard drives that we used back when I was in high school. I'm telling my age. Okay, but anyway, let me get back to it. I think I'm down to where y'all have said the answers. Okay, got you. Thank you so much, love. Thank you. You welcome. Eunice, nurses are special. Thank you. You welcome. Rochelle, you put arrhythmias. I don't know if that wasn't one of the answers or in the question either, but maybe you just was kind of putting something out there. But before I get to these, the patient I described is a dialysis patient. I don't know if anybody on the chat know about dialysis patients. If you do, say, I know about dialysis. If you don't know how to spell it, just say, I know about those patients. But with dialysis patients, because like I said, I was a nurse supervisor in dialysis, they may come into the ER because they have missed a treatment or they've drank too much fluids. Not all dialysis patients can pee. Some of them can. Okay, cool, Rochelle. Awesome. Y'all know about dialysis. So not all dialysis patients can excrete their urine. So they have to be on a machine to get to clean their blood, to get the fluid off of them like that. But if they've missed too many dialysis treatments, since their blood is not clean, their potassium level will increase. With the increase of a potassium level, you said it, Rochelle, the heart, arrhythmias. So the heart that messes with the cardiac area, okay? You don't want a high potassium. You don't want a low one either, because that messes with the heart too. So shortness of breath. I didn't say fluid on the lungs because I didn't want to give it away, and I didn't want to distract y'all from really getting the right answer. The scratch on the arm, that's minor. You know, it's not where they finger hanging off. That's minor. And then what do you do first? You definitely need to check vitals. And it looks like a lot of everybody said vitals. Rochelle, yep. Ashley with an IE. Rochelle want to check the pulse ox. Correct. Winford, give oxygen. So let me talk about that. You don't want to give oxygen if you don't know the vitals. Somebody can have you can give oxygen just for comfort, but if you truly don't know what their vitals are, meaning your blood pressure, your pulse ox, your temperature, your heart rate, you don't want to just give oxygen because they short of breath. You want to see what's going on first. The patient has fluid overload, so they need to be dialyzed. But you need to see where they are first. So when you give and report to the doctor, hey, this patient's short of breath, potassium of 6.6, and you can ask when they had, what's up with this twerk that? No, we're not doing that. We're not doing that at all. But thanks for your comment. Hopefully you gave me a like for that comment that you just said. Hopefully when you're seeing the doctor, you giving them a report on what you've already, and sometimes you're not going to see that potassium of 6.6 because you didn't give blood. You didn't get orders to give blood. But if they came via EMS, sometimes dialysis patients come from a dialysis unit, and maybe their access is clotted and they can't dialyze, and they did too much in between treatment and they need to be declotted, they need to be dialyzed, and you need to help that patient because all dialysis patients are sick. They may look like they're in good health, but you don't just get dialysis because you have dialysis. You're either diabetic, high blood pressure, something to do with your kidneys. It could be acute or chronic where you're on dialysis for 30 days and then you bounce back. But dialysis patients are sick. When we chart in there for dialysis patients, we don't say they have a good condition. They're always fair because it's multiple elements that get into a patient to become a dialysis patient. And it doesn't happen like that. It happens over time. Their body is fighting for them. Their kidneys are fighting for them to be a certain way, to be healthy. But if their body can't fight it enough and their kidneys fail, now you need something to help excrete the toxins out of your body and fluid and stuff like that. Okay, let me go back. But no, oxygen, you don't want to give oxygen without knowing what the oxygen level is. Okay, and remember, oxygen is something you need an order for. Oxygen is, oxygen is a medicine. People don't think of it like that, but oxygen is you need a medication order for it. Not necessarily medication, you need an order for it from the doctor. So if they want 2 liters, or if they come in, say you coming in and you an ER nurse and you season, you know what's going to happen. So if they come in, they short of breath, they huffing and puff, and you need something to cool down, you use your nurse judgment and then tell the doctor, hey, they hyperventilating. I'm trying to get the oxygen going through their nose and in their body. And then they, more than likely, the doctor will order it something for comfort. But in a perfect world, you need to get that order before giving it to a patient. Okay. Ashley, you'll get a pulse ox when you check the vitals. Exactly. Checking vitals is part of the assessment. Correct. Iman asking, who are you? Me? I'm a nurse. As you look at the channel, it says she nurse savvy. I am truly a nurse. And I'm trying to help. I'm trying to be helpful to my audience because I wish I had this 10 years ago when I was in nursing school, because this is helpful. Little small sit downs or getting questions answered. I didn't have that. I had a book and I had a Facebook group of people that were looking for help on how to test. Okay. She didn't give assessment as an option, so vitals will be first. Right. I didn't want to say, I said assess, but I said nope, 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 nope. Because I told y'all the first thing you want to do with a patient, if you see in questions on anything for nursing and you see assess, that's what you're doing first. You assess the patient. And it's not an assessment per se. You can assess somebody by just looking at them. You can see if somebody is in pain, if they're short of breath, the way they may have, the way their chest may be, you know, inflating, retracting, stuff like that. You can assess somebody just with your eyeballs. You can assess the way somebody looks when they're walking, their gait. Your assessment is always number one. But vital signs is a part of the assessment, but I didn't want to throw you off by saying assessment, because assessment, there are multiple things you could do for an assessment. Some people do head to toe assessments. Me, I don't. I never worked in an area where I needed to do head to toe assessments. I did focused assessments, the ERU focus. Actually, I'm sorry, I apologize. The ICU, we did head to toe assessments. Especially when we had the new patient, we would do the head to toe when they first came. So yes, that is a part of the assessment, but everybody doesn't do the exact same assessment. Okay, check vitals, check vitals. Good job, y'all. Please keep that recording. You will always know how her voice sounds. Oh, absolutely, Eunice. It's in my phone right now. I'm not deleting nothing. I think I don't know if I downloaded it in my voice memos, but yes, that's my heart right there. That's my heart. So I'm not doing nothing with that. And if I get rid of this phone, I am downloading it and I'm putting it on my computer. I'm not. I'm not. And I have videos of her. I mean, I would go and visit her all the time. I have videos of her. She was able to see my last child, which she's 6 now. But yes, that's my girl. I ain't about to get rid of none of the stuff that she's in that's on my devices. Okay. Check vitals, check vitals. Vital signs will help you in how to treat the patient. You also need to do labs also. Correct, because if a person comes in and says, oh, well, my doctor's office brought me in, they said that my hemoglobin was 3, and they don't look pale, and they not short of breath, they might have misheard. So you need to show proof. I mean, they can have a printout. If they have a printout and then say X, Y, and Z, okay, cool. But we need to know in our system what your hemoglobin is. So it may come back and a hemoglobin is 10. That's a big difference. 3, 10. Okay, so that's why the potassium is high. We need to know why exactly. But the potassium is high in this scenario. I didn't mention this is a dialysis patient, so the dialysis patient can't remove the potassium, or the machine excretes the toxins out of their body. And if they haven't been dialyzed, because your kidneys help a lot, your urine excretes a lot of stuff. If they haven't been dialyzed, then they have fluid, so they're short of breath. They have fluid on their lungs. They're short of breath. Their potassium is going to be high because they've missed treatment, because they can't get rid of it. They missed treatment. And that's when I kind of threw the little oxygen in there, but I threw the cut on the hand just to throw y'all off. But y'all smart, so y'all wasn't even worried about that little hand cut. Okay. Yes, so I put Mark Klimek in there. Definitely Google him. He is a lifesaver. Okay. Ashley, Rochelle, if you say vitals as the answer, now why are we commenting vitals was wrong when I said it? Okay. I didn't even get down to saying what was wrong and what was right. Ashley, everybody is right that said check vitals. Okay. QR codes. Yes, I think this was talking about the CD-ROM. It's QR codes now. Everything is so digital, which can be good in a way. You are blessed, whatever you are. Okay. They laugh out loud. They angry. Who angry? What? Okay. I'm gonna let that. Okay. You know about dialysis patients. I know about dialysis. Awesome. Eunice, I don't know, but I know they have a wait before they get on. Yes. So Eunice, smart. You know why they wait? Because there's a dry wait. But if they're brand new to dialysis, they have to dialyze a little bit to get down to their dry wait. But if they've already have a dry wait, they have that wait to see how much fluid they need to take off in order for them to get back to dry weight. Sometimes patients are way beyond their dry weight and you can't take off, say they're, because they do kilograms. So say they're 5 kilograms over. I'm sorry, not even say 5. Let's say they're 10 kilograms over. You know, we know kilograms is 2.2 times 2.2 to equal pounds. It's no way that you could take off 10 kilograms in one dialysis setting. You can't do it. The machine won't even do it. So it's that reason why they weigh before, they weigh after too. So they weigh before treatment to see how much is going to be taken off, as well as when they're done dialyzing, they get on the scale so that they can get a post weight to see how much fluid they still have left on their body, or if they're reached their dry weight, and then they come back in 2 days. All right. Kenzie Love Life put a whole bunch of stuff, W's and we's and W's. Okay. No twerk, no like. I'm not on social media to twerk. I do that at home with my husband. I don't have to show my behind to get likes. That's not me. That'll never be me. Let's just make that clear. Okay? Thank you so much for that comment anyway. Okay. It looks like y'all trying to get WLC United out. Rev said get out. Okay. Jacqueline, my dad has so much fluid in his system that the fluid is seeping from his skin. Jacqueline, is your dad a dialysis patient? Okay. Eunice, let's see. Did your dad? Oh, you're asking about, oh yeah, dialysis or heart failure. I thought about that too. CHF. Jacqueline, yes. So, oh, your dad has CHF. So hopefully he has a cardiologist that's trying to help him to live his best life, and hopefully your dad is abiding to what the doctor is saying to him. Hopefully that fluid will be out of his system. I don't know. He's probably going to be on diuretics, if not already, to remove the fluid from the heart. So hopefully he's getting what he needs. All right, vital signs are a form of assessment, focus assessment in the ED. Yep, Rochelle, you know, we focused in the ED. Nursing home nurses do full body assessment when patients are admitted. Okay, so yep, we do that for, I think they do that for, a lot of nurses do it, full body assessment, when they get on the unit. ED just don't. But if they come for something, or say a patient is soiled or whatever from a nursing home, and they have a brief that's really wet, and they kind of, their clothes don't look like, you know, we don't want to leave them in soiled, wet clothes. We want to, we'll do a little bit of, you know, what a bed bath real quick, throw them a clean gown on, a brief, put a warm blanket on, you know, because we don't want somebody coming in from outside and they soiled, you know. So as we're cleaning, we're looking at the patient to see if it's anything there too. If we see something, we say something. Okay. Thank you very much. I will definitely be looking you up. And I also subscribe. Have an amazing weekend, everyone. Thank you so much, Rochelle, for your comment, for your engagement, for your thumbs up, for your subscription. Appreciate that. Okay, Blue Devil, do you indulge in white chocolate? If you're talking about the actual chocolate that you can eat, yes. If you're talking about a if you're trying to be funny and talk about a human being as in light skin or somebody with a lighter complexion, my husband is lighter complexion. So with him, but not with anybody else, because I'm a happily married woman and I'm not going outside of that. Okay. Bullseye for Simply Best. You are a real lady. Thank you, Eunice. I try my best. I hope my mama raised me good enough to, you know, be that way, as well as I have 3 little ones, not little ones, because they think they're grown. But I have 3 daughters to raise to become real women as well. So, yep. Thank you so much for calling that out. I appreciate that, because some people online, they just throw anything on there because you live and it's a chat and anybody can type whatever they want. But I appreciate the positivity from that. Okay. He recently, oh no, Jacqueline. So, okay, Jacqueline, I think you were the one that talked about your dad. Oh, I'm so sorry. I'm sorry for your loss. I'm so sorry for your loss. Let me go up. Optimum Life. You're giving reality lessons. Awesome. I'm glad I'm giving a little bit of knowledge. You know, that's what my channel is for. I'm giving knowledge to those who need it, those who may not need it, but just want to hear me say some stuff in nursing. Cool. Appreciate that. Skin check. Yes. Skin check. Absolutely. That you definitely doing a skin check, because reason why you do skin checks, especially when you up on a unit, if the patient is going to be there for some time and the patient has bed sores, if you don't document that, the hospital eats that, okay? As in, it's the hospital's problem. So if you have a patient that already have a Mepalex on their sacrum and it's dated or whatever, you know, you want to look at it to see what's under there, to see if it's like a small skin tear or if it's like something really deep. You look at that and you chart it. So that first admission note is going to have everything going on with that patient all the way down to the toenail clippings, okay? Because you don't want that hospital that you work at to get dinged because they think it's a hospital acquired wound and it's really the patient already had it. Because if you're not turning your patient and doing all of that stuff, they will get a wound. They will, especially if they're not mobile. If they are bedbound, definitely getting a wound. Absolutely. So you got to do your part to make sure that if it was something already there before you got there, before the patient came, you document what you do. Okay, Eunice, I'm glad that I ran by your informational channel. Awesome. Thanks, Eunice. I appreciate your comment, and I try to be informative as much as I can, because right now I don't have my master's, so I can't do my nurse education right now per se if I wanted to work at a school to do lecture. But I'm working on it. I'm working on it. Let me see. Add Skipper Pro. Same when you rent an apartment, you document the state. Yes, absolutely. That is true. When you have I haven't been in an apartment in a while since I've been in these homes. I just like a house better for my kids and the yard for my dog, but I haven't you definitely have to document how your apartment was when you first got there. Another example, when you get a lease, just because you got a brand new car don't mean that it's impeccable, because some of those dealers drive those leases. So like if you get a demo, the cheap way of getting a brand new car is you get a demo. So something that got a couple thousand miles on it. It's still new. Sometimes they will scratch it. It may be a dent on it. And what you do is there'll be like some type of little letter that comes out. Oh, how was everything? Depending on who it was. Because I have a Cadillac. So Cadillac, you know, they bougie. So, they'll send out something to see how everything went. How everything went. Was it any scratches, dings? Was it something done? Was the car not detailed before you got it? Blah, blah, blah. Right? So, you put in what was done, because my recent truck that I have, it was a scratch in the front. So I didn't want to be dinged for that, because scratches, when you turn in your lease, they want to ding you. But it's a trick to that. You turn your car in dirty. And even my dealer told me that. He said, just turn it in dirty. You okay? But anyway, so what's your thought on companionship care? I'm interested in that as well. Break down what you mean companionship care. Tell me what you mean by that. I keep pulling these pants up because the last time I had my live, I had something low cut where my chest was out a few times, and there was so many comments that was about that. So now I'm covered all the way up, no skin other than my collarbone. But tell me what you mean about companionship care. Because when you say companionship care, I think about like being a live-in, maybe being a live-in person to help, like say somebody wants to be at home and they don't want to go to a nursing home. They want to live at home and they're willing to pay somebody to live in with them to help. Let me know if you're talking about that, Sierra, because I'm not 100% sure just based on companion care. I'm just telling you what comes to mind when I think about that. Anybody else have any comments, questions, or concerns? Feel free to put them in the chat. Y'all have been really attentive. I appreciate that. I mean, the last video was too, but it seemed like I was trying to get people to comment more with me. Y'all own it. I appreciate that. And I'm going to try my best to be consistent with these lives. And if you want me to talk about any particular subject for my next live, comment below, because my previous channel I had, there was, somebody hacked into my channel. It was like a fake brand deal. So I'm really cautious on brand deals because they hacked into my channel. And then had a live feed, and I had about 24,000 subscribers, and they totally bumped me out. I mean, I was monetized, getting monthly checks, totally cleared me out, gone. So with this one, I'm a little more cautious, and I've had multiple people send me brand deal stuff, and I'm like, I'm not downloading nothing on my computer. My MacBook won't even allow me anyway. But, I'm really cautious about this channel because it grew fairly quickly. I started doing videos on this channel actually at the beginning of this year, January. And my old channel that was got hacked the day 2 days before New Year's Eve. So that ticked me off. I was pissed. But it is what it is because I got blessed with another channel and I have 135,000 subscribers. I wasn't even touching that on the old channel. And I can strictly make this about nursing or healthcare. So I'd like to talk about the good, the bad, the ugly. So when you see my shorts and you see people are being mistreated, that's the bad and the ugly that a lot of people don't know. The good is when, you know, you see the doctor singing to the little girl that's sick. That warms your heart, you know, or the one that I did yesterday where it was a midwife that caught the lady that was delivering her baby literally before she even walked into the hospital. But that's the good. You know, she was able to be there and catch and help. And it sounds like my 6-year-old is up. So let me wrap this up. Okay, you're on point. Thank you. Let's see. What machines do you recommend owning as a practitioner? I'm not a practitioner. I'm just a nurse. I'm not an NP. I went to school for NP if you looked at my channel, but I dropped out because I don't want to be a clinician. I was at the point where I was about to start clinicals and it just didn't sit right in my spirit. So I'm not going to do something if it don't sit right. I'm not going to waste money trying to get a master's in a role that I don't want to do or feel comfortable with. So I'm not a practitioner. But for nursing, you want to have a stethoscope. You preferably want to have a Littman stethoscope. Those are the best ones. Don't get the little $20 one. Pay $100 for your stethoscope. I got mine in nursing school and I used my book voucher. Okay, I had a little bit of money after. I got a pink stethoscope that I've had for 10 years. That's something good. Okay, stethoscope. If you want to go on Amazon and get a pulse ox reader, I think those are like less than 20 bucks. And you can just keep that at home because it, say you feeling some kind of way and you want to check your heart rate or your oxygen level, you can put it right on your finger. But yeah, pulse ox. I have a manual blood pressure cuff too, but that's more so for at home. And I think that was during training anyway. We have an automatic one too because my husband was going through high blood pressure and needed medication. So I had to nurse him and make sure that he was on top of his game because we got a long life to live. Okay. How do I feel about technical school for nursing? So Crystal Clark. Oh, I went to school with a Crystal Clark. I don't know if that's you or not, but if so, hey girl. Technical nursing. So when you mean technical nursing, are you talking about like to be like an LPN school instead of going for your registered nurse? Crystal, are you talking about just some of those tech schools that do nursing? Because most of those tech schools that do nursing, most of them are LPNs, but you got to be careful. Some of them are regular, you know, but if you're going to go for RN, you need to go to a community college that's accredited or a university that's accredited, because some places will look up where you are. Oh, registered nurse. Make sure that the school that you're going to is accredited. And hi, Puddin' Pie. So let me finish with my video. Go in my room and you can cut on my TV.
What take too long?
You was taking a nap. That's why I did the video.
Mommy, you put this back on?
I will. Let me finish my video and then I'll tend to putting on your stuff. And then we can do the puzzle. Okay?
Hey.
So go upstairs and cut that TV on upstairs, not down here. Okay, thank you. All right. Registered nurse, yes, make sure it's accredited, because when you even get to some hospitals, or what if you try to work for the government, try to work for like Veterans Hospital, they will look your school up, and if you're not accredited, you're not hired. Even the regular hospitals, if your school is not accredited, they're not hiring you. So you wasted all of that money and that time with this new technical school that's not even accredited, they're not gonna waste their time on you, regardless of if you paid for the money. I mean, if you paid the money to do it, pass boards. Places are very particular now. Maybe back in the day they didn't care, but people want to be magnet status too, so they want to have accredited schools to make their hospital magnet. Hopefully that helped, and hopefully I wasn't too harsh, but that's how people are. That's how employers are. If they look up your school and they see it's some new place that just opened up down the street, and then you try to apply, you're going to be skipped over. And you're going to wonder, why did it take so long for me to get in here? And I'm a nurse. Usually when you're a nurse and you apply for a school, I'm sorry, you a registered nurse and you apply for a job, you getting called like that because they need you. So if you don't get the job interview and it's been a couple of weeks and you've applied multiple times, it's something going on. But keep applying, because it may be somebody to take you, but make sure you go to an accredited school with an accredited nursing program. Accreditation takes time. If it's a new school that's opening up right now, they're not accredited. It takes time. Okay, Crystal. Hopefully that helped. And every time I see your name, I think about somebody I went to high school with. But if you went to high school with me, you'd be like, hey, girl. But anyway, I know you probably not. It's multiple people that have multiple same names, multiple people. But anyway, okay. What state am I licensed in? I'm licensed in Michigan and Ohio. Simply the best. I am licensed in Michigan and Ohio. Not live-in. Somebody who just helps with meal prep and other things that the patient has a hard time doing, but just being company to patients who don't have family and being there for them so they are not lonely. Oh, that's sweet. So I think what they called it in Michigan is a chore care provider, something like that, because my grandmother had one. So of course family was there, but family all worked. So if she needed, when she started getting older, because she was 90 when she passed, when she started getting older, because she used to cook big meals for the whole family, she wouldn't cook as much. She definitely didn't go to the grocery store at all. She needed somebody to help wash her clothes, which my aunt would go and take her clothes and wash them at home and bring them back. But she had a chore provider. And I don't know if it's labeled something different, but the chore provider that she's had, because she got rid of some, and she did not, if y'all wasn't doing what y'all supposed to do, y'all not about to collect no checks. So she got rid of some. It wasn't a nurse per se. It was just somebody that could kind of help her. I think she got help with taking baths, like getting in the tub, taking baths or showers, going to the grocery store, cooking something if she wanted to cook. But my grandmother would roll a chair up to the kitchen and she would cook it herself, honey. When it was around the time where the last couple of years, I think I was pregnant with my youngest child that just woke up from a nap. I was pregnant cooking for her. So I would make her breakfast, and then she was in assisted living, so she was able to get meals with that. But best believe we took care of grandma. Okay, so you could do that. It all depends if that's your thing. Now, when you're doing the companion, what did you call it? Companionship care. Remember, all patients are not going to be sweet. You're going to get some that's grumpy and crabby, and you got to be able to roll with it. You got to be able to say, it's okay. Let me help you with this anyway. Let me do this. Let me do that. Okay? But it sounds really sweet so that they're not lonely. It really does. But just remember, there's a good side and a bad side to every job. Okay. I don't know what you said yep to, simply the best, but maybe you was responding or replying to what I was saying. Okay. Thank you. This is what I need. Oh, a credit. Probably the accredited school is what you needed to hear. Cool. Okay. So anybody else want to put something in the chat? You can do it. My little one is up. She gonna bug me in a few minutes, but she up in my room watching TV, so you don't hear a TV in the background. But go ahead and comment while we have a little more time left. And I'm here. And hopefully everybody that's still watching gave me a like, subscribe to the channel. If you want to hear something in particular for the next live, the next one, I do them maybe twice a month. I'm going to try to be consistent with being twice a month. You're welcome. Comment what you want to hear next. And then I'm going to put this on replay so that, you know, the people that couldn't attend the live could actually see it, and possibly they could you know, comment what they want to talk about, whether it's student nursing, whether it's what role is best for a new grad, for a LPN, what roles can the LPNs get into. RNs pretty much is everywhere other than being a nurse practitioner. What's the best way for me to get you know, what's the best way for me to get into healthcare? It doesn't all have to be nursing, but it's healthcare centered. So if you want to talk about that on the next live, we could do that. I like that. What's the best way to get into healthcare? I actually like that, because once you get into healthcare, I may have to write that down. That might be the next subject for my next live. Let me write that down so I don't forget. But I tend to make this channel more so about healthcare, 100% nursing, and from a nurse's perspective. But, you know, everybody's not a nurse. Some people may want to be a PA, physician's assistant. But I'm only telling you from my end. So let me know what you want to do. I'm going to wrap this up in a minute or two. Let me do one thing on this computer. I appreciate you guys for hanging in there with me, because I think we've been on streaming for about 2 hours. Y'all the real deal. I appreciate that. Appreciate that so much. Let me see. Anybody else want to throw anything out there? Questions, comments, concerns? Enjoy your weekend. Have a good day. Nurses are awesome. No, I'm just playing. I saw that already. Anybody else? Because I don't want to end it and somebody still has a question. So I'm going to give y'all a little bit. And I want to make sure I didn't miss any of these chats. And again, if you tune it in towards the end of this, I am going to replay it. I'm going to definitely replay it so that you could get some of the stuff that I said in the beginning, as well as when I opened it up. Because with my lives, I tend to have some stuff to say in the beginning. I'm late to the live. Have you done nursing home? Actually, I have talked about nursing home. I'm going to go... Here, let me go. Ooh, I keep forgetting y'all can see everything. I'm scratching my back. Okay, hold on. Thank you for the information. Thanks, I'll be back again. Definitely, yes, definitely. The warning as well. Good and bad, yes. I did talk about nursing home. Is Shikori Allen? I did talk about nursing home being one of those soft life jobs, but not all patients are going to be less stressed to deal with. It's going to be some patients that need total care. Hopefully they're in a facility that will give total care, but if, it's most nursing home things that you think about is like maybe you helping with catheter care or helping to straight cath the patient or give an infusion for an antibiotic for so many times in a month, things of that sort. So you definitely educating your patients, as I said earlier. But yeah, I have not. Have I done nursing home? I read the whole question wrong. Have I done nursing homes as a phlebotomist? I drew blood in a nursing home. I was a senior lab assistant, so I was one of the higher lab assistants. Right before I started nursing school, I was drawing blood at multiple nursing homes. So I was offered a position before even interviewing to work in a nursing home. And I think back then it was $45 an hour because, hold on, Puddin', I'm not done yet. Almost. Because with nursing homes, they want to pay the RNs a high amount. And again, this was 10 years ago, or close to 10 years ago. They want to pay the RNs a high amount because with the RN, you can do TPN and stuff like that. Where if it's just all LPNs, you can't do that. It's certain criteria that they need. So they want to make it look appetizing so that they'll pay you more than what the hospital will pay a new grad for. But no, I have not worked as a nurse in a nursing home, but I've definitely been in the nursing homes and I've seen a lot of stuff just when I'm drawing blood. Okay. I've been in a nursing home as well when family members go in there, because I pop up at different times to make sure that my loved one is together. So I've been there, but not working in a nursing home. I worked at a hospital when I was a phlebotomist to draw blood in a nursing home, and then I left. So if that answers your question, hopefully it does. But anybody else have anything before I wrap this up? I'm going to give you a minute, because this little one just asked, was I done? I don't know if y'all heard her in the background. Got to tend to my child and then get dinner ready before my husband gets off work. Okay, do you have to do pop-up in a nursing home? So simply the best. Oh, you said you have to do. Yeah, absolutely. Absolutely. Because if they know you coming, they're going to get it together for that loved one. But if you come at different times, not the consistent times, but different times, yes, you are agreeing. I got you. I read it different. So you already know. If you coming in at different times, on different days, they ain't got no choice but to make sure your loved one is put together. They not gonna do that for the one that don't have family coming. They just gonna leave that other one, however they are, which is unfortunate. Nobody should be left like that. But nursing homes are short-staffed. They've been short-staffed, and since they, a lot of comments said, since they stopped nurses from working who didn't have the COVID vaccine, that's when they really got bad. So you stretching 2-3 nurses to take care of 150 patients. When in the real world, they would have 20. I don't know when, but 20 patients, and you would have techs and stuff like that. It's ridiculous. Okay. Yes, you do. Let me see. I'm currently in a nursing home as a resident. Okay, sunshine. Hopefully everything is going smooth there. 1-to-20 ratio. That's what I thought it would be. 20 patients, simply the best. But when people call off and they don't have nobody, if that either the nurse supervisor or I think sometimes the DON get on the floor because they don't have a choice. If they can't pull somebody to help, it's just them 2 people. If they can't get an agency person in there because sometimes they have agency jobs where you pick it up for the day. If they don't have somebody to pick that up, then they stressing out their staff already, which is unfortunate. And like the lady that I did a reaction to that was splitting 140 patients with another nurse, she was agency. So, and the other lady was refusing to even help to do her full 70. So if you looked into that video, it said that she did one hallway. The nurse said she was refusing to do because she already have heavy patients. So that lady actually did more than 70 patients on her own in a nursing home as a travel nurse. But you know, as a travel nurse, I know myself, when you get into an assignment, you know it's going to be some trash. That's why they're paying you more money to get in there to help them. So make sure that you don't come in here thinking that it's going to be a perfect world when you're on a travel assignment, because it's not. That's why they're paying you that much money. You there to help them take the load off. Okay? And people was getting on that one girl, what you say? Simply the best? 140, that's against the law. I'm sure it is. And a huge liability for your life. It is. And people was getting on that one nurse that went and had a TikTok video about it. They was like, oh, well, you so busy, but you making a TikTok. That was her way of documenting what was going on. Me, I wouldn't have done that. I would have talked to my mentor, but everybody is different. If she wouldn't have said something, we would have never known that it was 2 nurses splitting 140 patients. We wouldn't have. And one of the CNAs got sick. She came to work, throwing up, went home. And sometimes you call off, people get wrote up for that, so that CNA had to come show that she was truly sick. I haven't had to do it, but some people have. So it is what it is. Let me see. It is rough. The care isn't like it used to be. Mental health is critical too. I'm sure it is. You know what? I wouldn't wish being short-staffed with 140 patients on no nurse, no nurse assistant, nobody. Okay? Because not even the patients, because the patients are in lack. Nobody can be there at the same time when a patient tries to get up out of the bed, like I mentioned in the one video where the guy wiggled out of the bed and he was face first and his daughter was upset and she was recording. Nobody can be there at any time, because nursing homes don't have sitters. They don't have staff to have a sitter. Hospitals barely have enough staff for sitters. So they have one sitter to look at multiple patients in a hallway. So it is what it is. Nursing is still awesome. You don't have to slave at the bedside. Your patient is neglected 100%. And they chew up the staff. And in my videos, I don't try to chew up the staff. I just point out the facts, but I know nursing is short. We need more people. They do need to pay CNAs more money. They pay the nurses a certain amount. They need to do the same thing for CNAs, because those facilities make that money, and don't try to penny pinch. If you can pay an agency nurse to come in here and help, you can pay your staff more money. So when people would look at me coming in there to help and they would look and assume how much I was making, it ain't my fault they not increasing y'all wage. They paying me way more. But it is what it is. Healthcare is a business. It's a business. They want to get money from insurance. They want to get all of this stuff, but they need to pay their staff a good amount to keep their staff. That's all I got to say about that. But I'm going to end this live. I preached a little bit at the end. Hopefully, if you appreciated the preach, you already liked the girls' live stream, and you already subscribed to the channel, hopefully.